rise to move the following resolution. Whereas pursuant to Article 29(1) of the Constitution, the Governor General may make a proclamation of emergency declaring that a state of public emergency for the purposes of this article exists in the Bahamas. Now, therefore, be it resolved that this House affirms the continuance and effect of the emergency powers COVID-19 pandemic, extension of Section 17(1) of the Local Government Act, Chapter 37, Order 2020, made on the 21st day of August 2020 until the 31st day of October 2020. Mr. Speaker, at the beginning of the COVID-19 pandemic, this deadly and very contagious virus was designated as a novel coronavirus. This means it was a new virus, a virus that the world had not seen before. And such a novel or new virus meant that the peoples of the world, medical professionals, scientists, governments, and countries had to learn as quickly as possible, as much as possible, about this very, very dangerous virus. We had to learn about how it is transmitted. We had to learn, Mr. Speaker, about how deadly and contagious it is and who are the most vulnerable. We had to learn how to diagnose and to treat those individuals infected by this virus. And the world began a massive and unprecedented global effort to create an effective vaccine, an effort that is still ongoing. We had to look back in history at past pandemics to see how to respond to COVID-19. We also had to look to new technologies and ideas, such as advanced contact tracing and modern diagnostics, to respond to a virus that spread around the world in approximately 100 days because of modern aviation and other modes of travel and transportation. Though it has seemed like an eternity, the world has been in this pandemic for slightly less than a year. We are still learning about this virus and its long-term health effect. And at the beginning of the pandemic, most governments imposed similar measures such as mask wearing, curfews, lockdowns, contact tracing, and physical distancing measures to limit the spread of this deadly virus. Our first priority, Mr. Speaker, my first priority and obligation was to save lives and to protect our people. And that has not changed. And this is why we acted quickly and aggressively at the very beginning, even though we were very heavily criticized by some in this chamber for our initial emergency orders and actions. Some of these critics, Mr. Speaker, said that the orders were unnecessary and too strong. Some in this chamber were slow to appreciate the dangers posed by this deadly virus and the emergency measures that were needed. Though they have been proven wrong over and over again, they have yet to acknowledge that we did what was right and timely in order to save lives. I once again offer condolences to the families of those who have lost loved ones. And let us continue to pray for the recovery of those in hospital or at home who are still struggling with COVID-19, including those with long-term health effects. Mr. Speaker, I am pleased that the Bahamas was among the first countries in the world to require the wearing of masks, though even then, there were those who said we were unnecessarily restricting certain freedoms and who appeared to play down the severity of the looming pandemic. However, thankfully, the vast majority of Bahamians understood the need to care for themselves and for one another by adopting various life-saving measures. Most Bahamians, Mr. Speaker, understood the need to be their brothers and sisters' keepers. They knew the diseases and its deadly effects were not partisan and did not bear political colors. I again offer fulsome praise for all of those in our country who responded quickly and with a spirit of national unity, including those who put aside partisanship and reached for a higher national goal, national good, and shared purpose. Mr. Speaker, I am truly grateful that my training and years of experience as a medical doctor helped me to appreciate the danger of this virus at the very beginning of this pandemic. I also realized as Prime Minister that the country needed to continue to find a balance between the health, economic, and social needs of our people. We knew it would not be easy finding such a balance, but that with the cooperation of as many Bahamians and residents as possible, we could confront this virus better together. This is the same search for balance that countries around the world continue to struggle with and will continue to struggle with for some time to come. It is a constant and ongoing balancing act. Mr. Speaker, over the past 7 months, we boosted our healthcare infrastructure to better respond to this virus. We improved national testing. We improved contact tracing. We revised emergency orders as necessary. We communicated constantly and regularly with the Bahamian people. We provided unprecedented financial, economic, and social assistance, especially to the most vulnerable. We are feeding, Mr. Speaker, tens of thousands of Bahamians who hit hard times due to the economic effects of the pandemic, with the government now spending approximately $1.3 million every week. We consulted widely with many stakeholders and the broader public, and we provided specific plans in a number of areas related to the virus, including phased plans for the reopening of the economy and the upcoming plans from the Economic Recovery Committee. When we erred and made mistakes, we acknowledged them. We listened. We did better. And we pledged to continue to do better. We are, Mr. Speaker, in this fight together. Today, in our Caribbean and North American neighbors, throughout the Americas, Europe, Asia, and Africa, and even in countries that are being acknowledged to have generally the best responses to the pandemic still requires various emergency orders. Indeed, many are currently battling new waves, with some returning to national lockdowns. I only ask individuals to look at the European nations. Israel. Nearly 1 million people have died, and no one knows when this pandemic will end. Few countries in the world no longer require some type of emergency orders and restrictions. I rise today, Mr. Speaker, in support of today's resolution, extending various emergency orders until the 31st day of October 2020. The measures in the emergency power orders are not ends in themselves. They are tools or measures used to protect and to save lives, and are available in case of an emergency, as a number of health professionals have noted publicly over the past few days. Today, Mr. Speaker, I also wish to note a number of changes to various emergency orders. Mr. Speaker, because our nation is an archipelago with varying circumstances, we sought to modulate the various measures depending on the specific circumstances in each of our given family islands. This is why we created various schedules of islands. And I am pleased to announce today that commercial and additional social activities may resume as normal on the following islands: Andros, Auckland's, Crooked Island, Long Key, Berry Islands, Bimini, Cat Island, Eleuthera, Grand Bahama, Inagua and Mayaguana, with physical distancing and mask wearing protocols in place. Mr. Speaker, this simple mask saved lives. I'd asked the Bahamian populace 3 weeks ago, or 2 weeks ago, to just adhere and wear this simple mask and adhere to the protocols for 3 weeks. Given that time, would be in a better position to save our economy, save more lives, save your brothers and sisters, mothers, aunts, uncles, and cousins. I ask for distinct cooperation. It would this simple mask, Mr. Speaker, would assist us in adequately opening up our borders safely. And I ask all Bahamians, this simple mask would save our tourist industry. And Mr. Speaker, I remembered former president of the United States, great president, asked the question, ask not what your country can do for you, but what you can do for your country. Now, Mr. Speaker, I say to you, this is what you can do. By wearing this simple mask, it is a shield against viral infection. It is an antiviral Scud missile. And in fact, some of the most professionals today are saying that the virus is just as effective or more effective than the vaccine. The mask. Some of the most prominent professionals today are saying that this mask is just as effective and in some cases more effective than the vaccine. And they recommend that we utilize the antiviral Scud missile that I hold in my hand. That is very effective. Mr. Speaker, Bahamians are very, very intelligent and creative. The other day, I heard a particular jingle talking about wearing of masks to save ourselves and do this for your country. Simple mask. The simple mask, Mr. Speaker. Yes, we had spoken just recently about an incident of a member of staff, House of Parliament, who was infected with the COVID virus. But I watch you, Mr. Speaker. You wear your mask continuously, and you were protected in spite of being some degree of proximity. I watched the other clerks, and they too wore their masks, and they too were protected, negative. And I watched this Parliament today, and every member is armed with their antiviral Scud missile. Mr. Speaker, you were protected. Therefore, it is time that the Bahamians, each and every Bahamian, do their part. And as we open and extend the opening of our borders, many countries are undergoing second and, in some instances, third surges or third waves. We can mitigate and prevent or minimize ourselves experiencing a third wave. Simple device can protect us until the vaccine arrives. Simple ammunition, Mr. Speaker. And therefore, I ask the Bahamians As Kennedy asked not what your country can do for you, but what you can do for your country. And this is your opportunity to have our borders opened and our people and our guests are safe. This is our opportunity to be recognized throughout the world as a COVID-free and a very disciplined and compliant nation. So as the rest of the world experience third wave, we can reduce that possibility by just simple discipline. Mr. Speaker, the islands that I mentioned join islands like Chub Key, Harbor Island, Long Island, Ragged Island, Rum Key, San Salvador, and Spanish Wells. Yes. Yes. While a curfew will no longer be in effect for these islands, health officials recommend that a 10 p.m. to 5 a.m. curfew remain in effect for Grand Bahama. Health officials also recommend that beaches remain open daily on the Grand Bahama from 5 a.m. to 12 noon for the time being. And because of the number of cases on New Providence, Mr. Speaker, the provisions under the current emergency powers orders will remain in place. And further, because of the performance of indicators being tracked by health officials, the provisions under the current emergency powers order will also remain in place for Abaco at this particular time. However, on Abaco, beaches may now open daily between 5 a.m. to 10 p.m. And if you want to go to 12 midnight, nobody cares. Enjoy yourself.
By yourself, you want to eat the salmon by yourself. We have many beaches. 3 miles of treasure keep. 3 miles.
Mr. Speaker, I have been longing to go to the beach, but the beaches here in Nassau, because they close at 12, and I'm normally at work 7:30, it don't give me much opportunity. But Andres is open, and I'm traveling to Andres with the Member of Parliament either Saturday or Sunday. We have not decided the time. And
which beach you going on?
North, which beach you going on?
I just bought the bathing suit. I didn't have a bathing suit. I just bought one this week.
Let him take you to Stony Creek now.
Now, I don't yet have the six-pack. What is it, 6-pack? The 6-pack to wear a bathing suit. So I will still have my T-shirt on. Is that okay? Mr. Speaker, weddings on all islands in the country may be held in a religious facility following protocols and the Ministry of Health approved guidelines currently in place for church services. Church services, Mr. Speaker, are now held in the church using protocols. Weddings must follow the same protocols. And they must all, at the wedding, except the bride and the groom, be armed with their antiviral Scud missile. For Abaco and New Providence, Mr. Speaker, Wedding receptions may be held outdoors only with physical distancing and mask wearing protocols. On all other islands, wedding receptions may be held indoors and outdoors with physical distancing and mask wearing protocols. Exuma, you happy? I didn't say you happy. You don't have to get up and bow. You can sit.
Just wanted the,
The chair recognizes the honorable member.
I wondered if the Prime Minister would confirm on the record that Exuma is in fact included in the list of islands he mentioned, because he did say it off the record, I believe. I didn't have a chance to get it on the record, and my people didn't hear it as well. So,
And
I just wondered if he would.
in case your people didn't hear it. In case your people didn't hear it. And they're only your people temporarily until election is called. So that my people in Exuma can hear, yes, yes, Exuma is included. No. Mr. Speaker, on all islands, that's Exuma thing, all islands, including Abaco and New Providence, funerals may be held in a religious facility following protocols and Ministry of Health approved guidelines currently in place for church services. For Abaco and New Providence, graveside services and or interment will be held with 10 people in attendance, not including officiant and mortuary workers. Repasts are not permitted for Abaco and New Providence. On all other islands, graveside. Abaco starting the turn. On all other islands, graveside services and or interment may be held with 30 people in attendance. Repasts may be held with no more than 20 in attendance. Mr. Speaker, I just visited Abaco. I mean, they lie on me all over social media. But I just came back. I just came back from Abaco, and I was shocked that a very active social gathering was occurring. Nobody wearing masks, and there was at least 150 individuals participating. And it's events like those that would cause one infected individual to just ricochet throughout the community. And therefore, I asked those individuals in Abaco, your economy is doing well. I spoke to young people over there, and they told me that they have 2 jobs and can obtain a 3rd one if necessary. The jobs are there. The only stranglehold in Abaco are the accommodations. But I've been reassured by the DRA. They've gotten the properties already. The plots of land, Crown has already been granted to the DRA. They've assured me that they've completed the RFP. The government will provide to its citizens the land free of charge. The government will only charge for the infrastructure. And depending on the number of lots, Mr. Speaker, the number of lots or plots will be divided into the cost of infrastructure. So it will not surprise me that the government had made a commitment, sorry, Mr. Speaker, government had made a commitment to also pay for the infrastructure. My apologies. The government had made a commitment to provide the Bahamian populace with the free land and to place in them place the infrastructure in situ. Therefore, they are inviting, DRA are inviting contractors to build particular homes where individuals can now buy these homes, excluding the cost for the land, excluding the cost for the infrastructure, and all homes will be built duty-free. All materials. Now, Mr. Speaker, what is so unique about this, there are some contractors, Andres Textile, and that's my home, it's coming. Annie Lutra. We know the property.
You know, we had Dorian
What is so unique about this, Mr. Speaker, the government does not have the funds now to put in the infrastructure, but the contractors would put in the infrastructure and build the homes. And therefore, if the home costs $80,000, $90,000, because the government made a commitment to put in the infrastructure and the contractor would have done that for government, the government will advance for those individuals if the infrastructure per lot is $5,000 or $10,000. If it's $10,000, then the government will advance $10,000 towards that individual's home, which meant that their down payment is already done. Mr. Speaker, the DRA should be commencing that very soon, and they should be having groundbreaking sometime next month in October for the community center in Central Pines, being sponsored and paid for by the international community and private sectors here in the Bahamas. Bahamians. But we have an aggressive plan. Andres is not excluded. Ilutra is not excluded. And we have Grand Bahama is not excluded. And Exuma, I won't say yet what we have planned there, but I can say it's not your plan, it's our plan. Mr. Speaker, on all islands, gyms are permitted to open, subject to protocols and guidelines approved by the Ministry of Health. Facilities will be inspected periodically by health officials. Who's going to be mad at me? No. That's why there's exercise on the street. That's free. You know, I have to take advantage of the freeness. Mr. Speaker, we remain committed to the reopening of the economy in the area of tourism by mid-October, with the necessary protocols that must be put in place. And tourism will provide another update soon. But Mr. Speaker, I again urge the Bahamian people that this can be successful. The Bahamas can be the envy of the world. Our tourism product can bounce back. Our borders can be opened safely. But we must travel with our God Messiah. Mr. Speaker, we will present a plan very soon, a plan to show, a plan to remove. So we'll present very soon, Mr. Speaker, a plan to remove both domestic and international quarantine related to travel. Yes, sir. and the Minister of Tourism will give an update on such plans very soon. Tourism officials, Mr. Speaker, in the public and private sectors have been working very hard over many months to devise plans for a phased reopening. It is unfortunate, unduly harsh, and unfair to criticize the staff of the Ministry of Tourism for having no plans. This, Mr. Speaker, is disingenuous, untrue, unhelpful, and unfortunate. If one has any advice or constructive criticism for the hard-working staff of the Ministry of Tourism and Aviation and other stakeholders involved in creating plans for reopening, such help would be welcomed. But it is deeply disappointing when some people launch unfounded and unfair criticism on those trying hard to launch the reopening of tourism. And I salute those tourist ambassadors, those who work with tourism, for their efforts. Mr. Speaker, let us give them our help and encouragement, not broad condemnation. I will have more to say about tourism in an upcoming national address on the economy. No one should be under any illusion as to how long and how difficult it will be to restore our economy generally and tourism specifically. Recovery, stronger, together, is going to take a long time. But I assure the Bahamian people that we are preparing the groundwork for recovery. This week, I will receive an initial report from the Economic Recovery Committee, which I will also report on in the weeks ahead. I also assure the Bahamian people that we will act boldly and will offer plans for structural reform that will transform, diversify, and modernize our Bahamas into a 21st century economy that will seize the future and will be a model for our region. Mr. Speaker, 2020 has not been the year any of us imagined. The COVID-19 pandemic put on hold so many of the hopes, dreams, and aspirations of our people, including our young Bahamians. Children's education has been disrupted. Many businesses, including small businesses, are still struggling. We have spent months barely seeing our friends and relatives out of fear of catching or spreading the virus. Vaccines are in development, but when they will be ready and when they will be deployed comprehensively around the world is unknown. This pandemic is the most significant national emergency in our modern history. Bahamians have died, Mr. Speaker. Bahamians are sick. There are also those who have long-term health effects, some of which may last for many years or a lifetime. There are people who had the virus some time ago and supposedly recovered, yet they still suffer debilitating and lingering effects. No one knows how long these effects will last. Many are suffering. Our forefathers wisely saw there would be times like these when our nation would be put to the test. They entrusted in the Governor General the lawful power to declare proclamation of emergency. They knew that in an all-out crisis, swift and decisive action would be needed to save Bahamian lives. We are here to extend those lawful emergency powers because we are still in an emergency. We live in an emergency due to the pandemic. This is the first time in our modern history that our government has had to fully mobilize to face a crisis of this nature, affecting the entire Bahamas simultaneously. All resources are being brought to bear in our hospitals to treat the sick. We are providing historic and unprecedented amounts of unemployment benefits and assistance to individuals and businesses alike. Mr. Speaker, there are people who oppose this government for various reasons. That is their right. This is a democracy. However, it is unreasonable for any critic to say this is not an emergency and these powers are not necessary. That argument, Mr. Speaker, is simply wrong. One cannot say that we do not need certain emergency orders and at the same time say that the virus remains very serious. Saying both of these at the same time is wholly contradictory and makes no sense. The emergency powers orders give the government the necessary ability to act quickly to prevent or lessen viral spread. The provisions in the emergency power orders have been prescribed as narrowly as possible. No activity by citizens and residents is prohibited or constrained unless required for public health and safety purposes. Our health team surveys the circumstance, analyzes the data, and makes recommendations to combat the virus based on the situation at hand. We take that advice, Mr. Speaker, and use the emergency powers orders to save lives. Without the emergency powers orders, the virus would run wild in our communities, killing a large number of people in record time. This is how serious this crisis is, Mr. Speaker. That is how infectious and deadly this virus is. Mr. Speaker, my government, this government, does not like lockdowns. We understand they are hard on family life. They're hard on businesses and individuals' finances. They're hard on people's mental health. When virus cases increases, we try first to impose other restrictive measures. But if cases rises exponentially and virus spread is out of control, we may have no choice but to order a specific area locked down to save lives, as have most governments. That is, most governments around the world, including countries that have been acknowledged to have had generally a good response to the pandemic. But thankfully, Mr. Speaker, based on the data at hand, we appear to be nearing the end of our second wave of this pandemic. Mr. Speaker, allow me to expand on this particular point. When I say we can do selected or aerial lockdowns, I live in the West. So let's take for example, and this is just an example, I'm just picking a scenario. This is not reality. But if an infection, let's say, was in the Gambia area, we can lock that area off and resolve that issue. In Adelaide, we can do the same thing. In Mount Pleasant, we can do the same thing. And there are different segments throughout New Providence, and that's what I meant when I speak about selected, not broad-based. But thankfully, Mr. Speaker, if each and every one of us would cooperate, stop the late social gathering, those are what are our challenges today, we would be able to come out of this viral infectious phenomena very, very quickly. So let me be very clear, Mr. Speaker. The second wave is not yet over. Additionally, given global trends, we can likely face a third wave, but we have. We entered this viral pandemic without ammunition. The world knew not what to do. We were all fighting an invisible enemy, and we had no ammunition. They were aggressively working on vaccine, which would be a permanent ammunition. But as the virus and the disease progressed, we then recognized that we have an ammunition of mask wearing, an ammunition of social distancing, and an ammunition of proper sanitization. The ammunition is not expensive. It isn't that we have to have trucks with real missiles, guns, etc. But we have our ammunition. Let us use them, Mr. Speaker. Wear a mask. Save lives. Save your country. That is what you can do for your country. Mr. Speaker, so our moving forward and our success would depend on us adhering to protocols, adhering to travel protocols as we commence international flights. These travel protocols will not be expensive, but it calls for discipline. And that discipline can prevent us from experiencing another surge as we've just recently experienced and about to come out. Our borders are open today, but as individuals recognize that the Bahamas is truly open for business and the virus decreasing, and our family islands are basically almost free or considered free, because there are a certain number that we must live with, Mr. Speaker. We cannot aim for zero. It's not gonna happen. It's not gonna happen. Just like the flu is with us, that will be with us. So we must manage it. It will be like our brothers and sisters who came, nothing we could do. But we have to live with it. But let's keep the numbers down. That's the most important thing, down. And if we keep the numbers down, we are okay. And the Bahamas would be recognized as a COVID-free destination. It means that our real property values would probably go up. Our home rentals would probably go up. The Airbnbs will go up. The family islands, Andres, will blossom. Even I'm trying to buy a property in Andres. I don't want government property. I don't want nobody accuse me. I'm trying to buy a property in Andres. So I want to build a home in Andres. No. I love the family islands. I love the family islands. And to be honest with you, I would like to spend all my weekends in the family islands if I could. I love the family islands. And I can say with confidence that I will retire in the family islands. And I look forward. I look forward to that retirement in 2027.
Yes.
Mr. Speaker, I thank our hard-working medical team for all that they have done to help reduce the numbers over these recent months. I also thank the Bahamian people for their compliance and cooperation with the public health guidelines. And while there are some who ignore the measures, the large majority of Bahamians and residents are abiding by these measures. They have worn their mask. They have tried to stay physically distant. They have kept their hands sanitized and away from their faces. Until there is a vaccine or treatment, these are still the best measures to keep Bahamians and their families safe. And as I've said before, Mr. Speaker, the pandemic is far from over. In fact, it is possible there could be a third wave in the Bahamas, and there has been, as there has been and will be in other countries, but we have the ammunition to prevent it. It's up to us. Don't allow us to experience what we are going through now again. We can prevent it. We know this from the pattern of spread of the virus, Mr. Speaker. It's very contagious. As people travel more outside of their homes, congregate, and let their guards down, when one wave ends, the virus comes back. So, we must guard against complacency. We must not let our guards down. As a people, we must do all we can to lessen the impact of a third wave. Key to this, Mr. Speaker, is that each of us and all of us must be even more committed to using the measures we used to slow the first and second wave. The more we consistently comply with these recommendations, the better we may control a third wave. By limiting the number of people infected in a third wave, we lessen the need to impose the most restrictive measures such as aerial or regional lockdowns. Fighting COVID-19 is a national effort, and we have to work together. The virus is not concerned about red, yellow, or green. In order for the virus to survive, Mr. Speaker, it must get into our bodies. My body is not different from South and Central Andrus's body, or even Exuma's body, the virus can live in any of our bodies. And therefore, we are all a part of this fight. Let us fight and conquer this virus. Let us start our economic engine running, after which we can start our political fight, but save our country at this particular time. Each and every Bahamian and resident speaker is key to our success. It only takes one infected person going to a gathering and not following guidelines to cause hundreds of infections. Let history remember us, South Andres. Let history remember us as one of the most disciplined nations during a pandemic. Let history remember us as the small nation that led the world in eradicating and conquering this pandemic. Let us be remembered, South Andres and Exuma, as a people who worked together toward a common goal of keeping our communities as COVID-free as possible. Continued national commitment to that common goal and common good will save lives and lessen suffering. Mr. Speaker, let me close by again thanking our medical and health experts for their unwavering dedication, national spirit, and love of country. I also again thank Dr. Mercelin Dow Regis, who deserved the highest praise and high national recognition for her tireless efforts on behalf of us all. She is a symbol and example of the best of the Bahamian spirit. She has remained steadfast and dedicated to the greater good and the common good. I am sure, as I look at you, the members of opposition, you too, I am sure the House will join me in acknowledging the good work of Dr. Dow Regis and the health experts. There are so many fine examples of this spirit of resilience, determination, and national loyalty, which will bring us to a better day. But for now, let us stay resolved and let us stay strong in the fight against this deadly virus. Let us stay strong in our determined efforts to open our country in order to restore lives and livelihoods. Mr. Speaker, I support the extension of the emergency powers orders and ask God's blessings on our Bahamas. And before I move this resolution, Mr. Speaker, I would advise all Bahamians, kindly, please, obtain your flu shots. The hospitals are already overstretched and overburdened. Our medical team are overworked. And in spite of that, they continue to work. They continue to deliver health for the safety of our people, but they are tired. If we took our flu shots, that would decrease the incidence of flu and thus decrease that extra demand on our hospitals. thus compromising our hospital facilities and making it even worse and placing us in an even more difficult predicament. So again, I urge and I ask our vehemence, especially those who would be at risk, the elderly and others, to kindly obtain their flu shots. Mr. Speaker, I so move, and thank you very much, Mr. Speaker.
Thank you, Honorable Member. Is there a second? The chair recognizes the Honorable Member for Bamboo Town.
Detailed, substantive contributions as to why we should maintain this emergency powers. Order. Mr. Speaker, I am fond of doing, I rise. Say thanks be to God who always leads us to triumph in Christ and uses us to spread the aroma of the knowledge of God everywhere. Mr. Speaker, I rise on behalf of the people of Bamboo Town to second the motion of the member for Kalani, the Honorable Prime Minister. And as I said earlier, to extend the emergency powers orders to October 31st, 2020. Mr. Speaker, for the Bahamas, we are now at day 194 of the COVID-19 pandemic. Day 194 since our first lab confirmed cases on the 14th of March, 2020. Mr. Speaker, pandemics are a time we've come to know to persuade entire populations to suspend or modify their lives and livelihoods because of an invisible and existential threat. Mr. Speaker, while we have registered 343,467 confirmed cases today, we give thanks to God for the people who have and are recovering from what can be a fatal illness. As of yesterday, more than 50% of the cases, some 1,871, have cleared the recovery hurdle. Mr. Speaker, we still have 1,489 active cases with 4,188 contacts being followed, which means that we are far removed from safety in terms of the transmission of this disease. More than that, Mr. Speaker, deaths from COVID-19 continue to rise. We've had 77 deaths across 8 islands. Too many despite the valiant efforts of our healthcare workers. The death reflects our population distribution, with New Providence accounting for the largest amount, some 56 persons, followed by Grand Bahama with 14. Mr. Speaker, I want to reiterate and to state, as the Prime Minister stated earlier, we are still in the midst of a pandemic. And Mr. Speaker, this second wave is claiming younger lives when compared to the first wave. The average age of the deceased is 12 years younger at 61 years in the second as compared to the first wave, where the median age was 73 years. However, Mr. Speaker, it should be noted that the age range for 48%, nearly 50% of the COVID-19 positive cases, is between the ages of 0 newborn to 39 years. 50% of the COVID cases are between 0 and 39 years. And in contrast, Mr. Speaker, to the first wave, there has been a number of deaths in this age range of 0 to 39. Mr. Speaker, the value of our healthcare workers has been more prominent. Throughout the Bahamas and around the world, healthcare workers are focusing their efforts on preventing, diagnosing, containing, and treating COVID-19 patients. They deliver care and services to the sick, either directly as doctors, nurses, and emergency medical technicians, or indirectly as aides, laboratory technicians, pharmacists, food service workers, space cleaners, transport officers, and medical waste handlers. Every day they go to work, not knowing if they're going to be infected or will inadvertently infect others. They have apprehensions, Mr. Speaker, but yet they put them aside and focus on caring for others. Mr. Speaker, I pause to say thank you, as the Prime Minister also did, and encourage all of them to press on. For as the good book says, for I am confident in this very thing, Mr. Speaker, that he who began a good work in us and in this nation will bring it to perfection. Mr. Speaker, the global effects of COVID-19 are not lost on any of us. We sounded the alarm in this honorable House and in other platforms and spaces that COVID-19 will be with us for the foreseeable future. Globally, some countries are now being hit, as the Prime Minister also said, with a third wave of this pandemic. The Bahamas, Mr. Speaker, is not immune. As we make slow but steady progress to emerge from the second wave, and as the Prime Minister pointed out, we are on the tail end of that, it will be incumbent on us all to do what is necessary to minimize transmission and subsequent new COVID-19 cases. Mr. Speaker, around the world, yesterday Al Jazeera reported that the daily UK cases alone numbered in the thousands, as experts say the true figure could be in the tens of thousands. The report went on to say that the number of coronavirus cases globally has now passed 30 million, as the World Health Organization sounds an alarm over the rising rate of transmission across Europe. It could conclude, and the article did conclude, that more than 300,000 people have been infected in Europe over this past week. Mr. Speaker, this was a newspaper article in India, which was titled "Why India's COVID Problem Could Be Bigger Than We Think," sheds light on the dire situation in that country. The article in part says that it took 170 days for India to reach the first million cases. The last million cases in India took only 11 days, Mr. Speaker. Average daily rates in India shot up from 62 in April to more than 87,000 in a day in September. In the past week, Mr. Speaker, India has reported in one instance more than 90,000 cases in a day and over 1,000 deaths in that one day. It speaks to the magnitude of this crisis globally, Mr. Speaker. Mr. Speaker, most nations have tackled COVID-19 with lockdowns in varying forms. Mr. Speaker, Sweden is probably the only nation that took the novel approach of having no lockdowns. And we've seen how Sweden has suffered in a number of ways. On the other hand, Mr. Speaker, Jamaica, Australia, New Zealand, the United States, and some countries in Europe took the approach with partial lockdowns, cities, provinces, and parishes, while Great Britain, Italy, and Sweden declared national complete lockdowns of their entire countries. Mr. Speaker, we here in the Bahamas have used complete lockdowns, national lockdowns, as well as island-wide lockdowns. For example, Bimini in the first wave and Grand Bahama in the second. The island lockdown of Grand Bahama and Bimini have demonstrated large successes in flattening the infection curve. Today, Mr. Speaker, Bimini has registered 21 days without a new confirmed case. To the people of Bimini, I say, well done. Grand Bahama, while still registering very, very, very small numbers of new cases, has also done well. Mr. Speaker, we are making strides on islands such as Cat Island, the Berry Islands, Aucklands, Maguana and Crooked Island, which have gone almost 2 weeks or more with no new reported COVID-19 cases. In fact, Mr. Speaker, Cat Island has gone 42 days. The Berry Islands, 39 days. And Auckland's 24 days. To the residents of those islands, again, I say well done. And we were seeing the fact that we've not seen any new cases, that the Prime Minister, under the health advice, has taken the decision to allow greater economic activity and freedom in those family of islands. Mr. Speaker, I encourage all of our smaller island communities to continue to do all that they can to protect their space through maintaining physical distances, wearing masks, sanitizing their hands, and sanitizing frequently used devices and common spaces. Mr. Speaker, we have seen, however, the vast majority of cases here in New Providence, the largest and most densely populated island of our archipelago. And since our last update on Monday, the 14th of September in this place, we have had some 459 new cases. 386 or 84% of those new cases have been in here in New Providence, which continues to be our epicenter. Here, Mr. Speaker, we have seen our healthcare system, particularly our only public tertiary acute care facility, overwhelmed with COVID-19 patients who have been more severely ill than in the first wave. With this scenario, Mr. Speaker, deaths are an unfortunate consequence. The Prime Minister would have spoken to earlier as well. Early on, Mr. Speaker, in the COVID-19 outbreak, the delicate balance between increasing new cases and the potential for overwhelming the healthcare system capacity for assessment and treatment of COVID cases was signaled as a concern by the Prime Minister, former Minister of Health. In our last update, Mr. Speaker, the challenge with the morgue capacity at PMH being exhausted was brought to the nation. Bed capacity in care and assessment units at PMH, inclusive of accident and emergency, GPC, and legacy units, are also now at capacity. While South Beach Clinic is now functioning as an expanded patient care center, we do have 167 healthcare workers, Mr. Speaker, removed from service due to COVID-19 exposure, as well as increasing fatigue of those remaining on the front lines. Mr. Speaker, all efforts are being taken to augment the acute care infrastructure with healthcare personnel. Mr. Speaker, on the other hand, New Providence Abaco and Eleuthera. Unfortunately, Mr. Speaker, as of yesterday, have recorded some new cases. Mr. Speaker, Eleuthera has recorded 3 new cases in the past 24 hours. Abaco has reported 5, and New Providence, some 41 new cases in the last 24 hours. Mr. Speaker, I've said it in this place before, and it bears repeating. Well ahead of this pandemic, over time and administrations, the human infrastructure and technological foundations of our healthcare system required bolstering. We knew that we would be challenged to withstand a severe surge if actions were not immediately taken. Mr. Speaker, one of the strategies to mitigate this challenge was to institute lockdowns, to break the chains of transmission and control the numbers of infected people. During this period, critical infrastructural upgrades to our tertiary facilities were undertaken to ensure augmented capacity for management of COVID-19 patients. These included increased acute care bed capacity, increasing our lab testing capacity, and fast-tracked repairs and upgrades to public health facilities, particularly here in New Providence and Grand Bahama. Mr. Speaker, for the COVID-19 response in New Providence, we would have expanded the bed capacity in the legacy unit of Princess Margaret Hospital from 4 beds to 8. We would have repurposed the South Beach Health Center to serve as a 24-hour urgent care and referral center with a team of healthcare providers from the department and Princess Margaret Hospital to assess and treat patients with symptoms suggested of COVID, as well as admit up to 26 mild and moderate cases, and contracted 22 beds at Doctors Hospital West and an additional beds at Doctors Hospital East for patients with COVID-19. In Grand Bahama, Mr. Speaker, there are 16 beds at the Cancer Association of the Bahamas building, Freeport, and 7 beds at the new Infectious Disease Center. Beyond our tertiary consideration, Mr. Speaker, we have concentrated our response to bolstering our public health measures while maintaining access to primary health services, urgent and emergency medical services, and mental health services at facilities in New Providence and the Family Islands. We continue, Mr. Speaker, home care services, including follow-up with mothers and their infants post-delivery. Mr. Speaker, more than 20 patients suspected of having COVID-19 were airlifted to New Providence from the Family Islands. We have taken the decision, with the improved situation in Grand Bahama, and the Prime Minister advised and the health professionals accepted, to transport suspected cases from the islands of Bimini and Abaco and their keys to Grand Bahama for emergency services. Mr. Speaker, we have improved access to COVID-19 screening for suspected cases at all main clinics and the Family Islands, with South Beach Health Center being the lead facility in New Providence. Over the past 6 months, we have sustained access to all primary healthcare clinics in New Providence and at least 56 main healthcare centers among the Family Islands, closing temporarily only when high-rise cleaning and sanitation of those facilities was needed. Mr. Speaker, we have expanded service hours of the Elizabeth Estates, Fleming Street, and Flamingo Garden clinics from 9 a.m. to 9 p.m. to discourage traffic to the Princess Margaret Hospital, and open Flamingo Gardens Clinic on Saturdays between the hours of 9 a.m. to 5 p.m. Mr. Speaker, despite the human resource challenges, the Department of Public Health continues to reassign its health human resources to strengthen the disease surveillance and our contact tracing unit to continue to slow the spread of this deadly virus. Mr. Speaker, case confirmation of any infectious disease outbreak is hinged the laboratory testing capacity, as was mentioned earlier by the Prime Minister. As of yesterday, a total of 17,341 tests have been completed in country. We have made significant strides in this area, having resourced the National Reference Lab to revert the testing turnaround time to 24 to 48 hours from sample to receipt. We have adequate supplies of RT-PCR test kits, RNA extractor kits, and reagents required for testing. And additional molecular testing modalities are being deployed in the acute care environment of PMH in New Providence and at the Rand Memorial Hospital in Grand Bahama. Our testing protocols has expanded with testing priorities clearly articulated to maximize use of our scarce resources. All avenues for procurement of additional kits and reagents are being explored, recognizing the existing global challenge. We are also benefiting, Mr. Speaker, from private sector laboratory capacities, which have now come constrained. Currently, Mr. Speaker, there are 2 gene expert machines and 1 Panther fusion system being used at Princess Margaret Hospital to provide diagnostic RT-PCR testing for the COVID-19 virus. The Panther fusion system produces faster results than the gene expert machine, and we're putting the Panther to good use. Mr. Speaker, we're also looking at new technology for testing. Recently, Mr. Speaker, the U.S. Food and Drug Administration authorized a low-cost and non-invasive saliva-based polymerase chain reaction PCR test for COVID-19 that retains much of the accuracy of traditional nasal swabbing. We are now testing its efficacy in country for possible use in the Bahamas. Mr. Speaker, my ministry supports extending the emergency order and to continue the implementation of our well-coordinated, predictable, and transparent approach to this new normal with the protection of public health as a priority. We acknowledge that we must avoid further disruption of our already fragile economy and additional uncertainty for our constituents throughout this nation, Mr. Speaker, who have made huge sacrifices. As the Prime Minister said earlier, the Prime Minister has called on the nation to continue to do so over these coming weeks. Mr. Speaker, the economy will therefore have to be restarted while COVID-19 is still an active and immediate threat. We therefore support smart, targeted containments coupled with economic restart to curtail human and economic losses. Mr. Speaker, again, I support the extension of this emergency order for our healthcare workers who need us to once again be patient and cooperative to save the lives of our loved ones and themselves. Mr. Speaker, I've said it before, and it is important enough to say it again. Our decisions for and on behalf of the Bahamian people are not arbitrary nor unweighted. Our constituents' safety, welfare, and well-being are primary considerations for public health and our economy. Mr. Speaker, we will continue to effectively respond to COVID-19 by promoting public health and safety, encouraging community participation, social mobilization, and peer responsibility, which is holding each other accountable. All of us want to see the back of COVID-19. In this environment, we must not lose hope. With all that we do, we ask that Jehovah Rapha, the Lord our healer, would hasten the healing of our world, and in particular, our beautiful nation, the Bahamas. Mr. Speaker, we are in the new normal. Getting back to business requires physical distancing measures, minimizing person-to-person contact, wearing masks, washing our hands frequently, and ensuring that frequently touched surfaces are disinfected regularly. Mr. Speaker, based on the public's cooperation thus far, I am still of the view that we have large consent from the Bahamian people to move ahead with the continuance of these emergency powers. And Mr. Speaker, I'm therefore pleased to second the motion by the member for Kalani, the most honorable Prime Minister. In all things, Mr. Speaker, may the name of Yahweh Elohim be praised, and may Yahweh Elohim continue to bless our work and the people, the Commonwealth of the Bahamas. I so
Thank you, Honorable Member. Honorable members, it has been moved and seconded that the following resolution be agreed. Whereas pursuant to Article 29, subsection 1 of the Constitution, the Governor General may make a proclamation of emergency, declaring that a state of public emergency for the purposes of the article exists in the Bahamas. Now, therefore, be it resolved that this House, A, approves the continuance of the proclamation made on the 29th of June 2020 until the 31st day of October 2020. B, affirms the continuance in effect of the Emergency Powers COVID-19 Pandemic Regulations 2020 made on the 29th day of June 2020 until the 31st day of October 2020. C, affirms the continuance in effect of the Emergency Powers COVID-19 Pandemic Number 6 Order 2020, made on the 10th day of September 2020 until the 31st day of October 2020. D, affirms the continuance in effect of the Emergency Powers COVID-19 Pandemic Special Provisions Order 2020, made on the 30th day of June 2020 until the 31st day of October 2020, and E, affirms the continuance in effect of the Emergency Powers COVID-19 Pandemic Extension of Section 17, subsection 1 of the Local Government Act, Chapter 37, Order 2020, made on the 21st day of August 2020 until the 31st day of October 2020. As many, the chair recognizes the honorable member for Mangrove Key, South and Central Andros.
Thank you, Mr. Speaker. Speaker, I stand to be very brief this afternoon on behalf of the good people of Mangrove Key, South and Central Andros. Mr. Speaker, I'll get right to the chase. As a matter of fact, I told the good member for the Exumas and Ragged Island, it was one of the Prime Minister's most closest coming to ever national address this afternoon. He was less polarizing this afternoon, so therefore I thought about cutting out pages 5, 6, and 7, but it's very difficult to change midstream. So I would save some and give the rest to Bamboo Tang and Carmichael. He can carry it to the member for Kalani. It's political season, that's what it is right now. Mr. Speaker, according to the recent World Bank Group Hub Report 2020, COVID-19 not only represents a worldwide public health emergency, but has become an international economic crisis that could surpass the global financial crisis of 2008-2009. Right now, containment mitigation measures are necessary to limit the spread of the virus and to save lives. However, they come at a cost. Shutdowns, which have been the easiest run-to phenomenon, simply leads to reduced economic activity and has general implications to our health and well-being concerns. These human and economic costs are likely to be larger in developing countries, such as ours and other CARICOM territories, which generally have lower healthcare capacity, larger informal sectors, shallower financial markets, less fiscal space, and poor or less transparent and/or accountable governance. Policymakers, therefore, will need to weigh carefully the effectiveness and the socioeconomic consequences of containment and mitigation policies, responding to epidemiological evidence on how the virus spreads and trying their best to avoid unintended consequences. Economic policy, therefore, in the short term, should be focused on providing emergency relief for the vulnerable population and those affected businesses. Therefore, taking into mind the Bahamian context, consideration should be given, as was stated and shared with me by local advisors, that the short-term goal is not to stimulate the economy, which is virtually impossible or could be challenging at best, but to restrict containment measures, but rather to avoid mass layoffs and bankruptcy. Therefore, in the medium term, macroeconomic policies should turn to recovery measures, which typically involve monetary and fiscal stimulus. However, in many developing countries such as CARICOM and other third world countries, these stimulus have been virtually less effective because of partisan politics, ineffective monitoring protocols, and weak assessment prior to capital injections for the best possible outcome in the wider society. Therefore, anticipated fiscal space and financial multipliers are often small, but they've warned, according to the World Bank and IDB, that in putting efforts and stimulus in place, I would say it in the Bahamian vernacular, put something on the ground, but make sure when you put it on the ground, put it in good soil. A more viable goal for microeconomic policy in developing countries is that of avoiding what they call a counter-cyclical overture or conduct by government. This simply involves not involving the private sector enough. Also taxes and visceral or whimsical political spending to appease those who are closest to political parties and operatives. And these could lead to government making it difficult to make basic payments and to survive financially. And therefore, the vulnerable is left in the cold. Because COVID-19 is truly a global shock, international coordination is essential in economic policy, healthcare, and science. Once again, containment and mitigating efforts are critical. Critical times call for well-designed government action and effective public service delivery, preserving rather than ignoring the practices of macroeconomic stability and proper governance that serve its people best in good and or bad times. Mr. Speaker, ECOSOC 2020 report states that beyond health, the COVID-19 pandemic has created the worst human and economic crisis in our lifetime. Hundreds of millions of people have lost their job and livelihood. While the impact may have been mitigated in some cases by emergency social protection measures taken by governments, many have received inadequate or grossly delayed support. And so therefore, quickly it brings me, since we're headed into the political season, it brings me to the home front. I would note today that, Mr. Speaker, most of the bills that have come to this honorable place have been dominantly financial bills. So therefore today, as I stand here today, I would note the fact that we cannot simply put everything on Dorian and COVID. We cannot put everything on Dorian and COVID. You must at the end of the day, consider pre-COVID, pre-Dorian, the ill-considered VAT increase of May 2018. In my view, the reluctance of this government to aggressively consider the minimum wage pre-COVID, considering the fact that it is some of your own policies that have led to some of the inflation that has been inflicted upon our people. There are still others who are, this afternoon, I had a gentleman call me just the other day, Carmichael, who talked about non-payments or slow payments to vendors or contractors who are expecting legitimate VAT refunds. Revenue collection, Mr. Speaker, as we would have heard during the budget debate, could be missed by some 230 or some 8% of the last fiscal year. And the projections are the trajectory is the same for this fiscal year also, Mr. Speaker. We certainly have those who are still awaiting in the islands that were affected by Hurricane Dorian. There are $10,000 per household that fell into the greatest need category. I'm also hearing, as the member for Yamacraw, my MP, would have said this moments ago, but hearing, I'll be honest with this one also today, that there are those in Grand Bahama who would have gone to a lumber company just today and were told that they could not use their voucher because the government must have some matter was not dealt with, their bill being settled at this entity in Grand Bahama today. So that's where we are. The National Food Program, a great initiative during these very tough times. $16 million allocated from taxpayers' dollars, all of us, for our people. But still some family islands and also some New Providence districts have been challenged by accessing these food and food items on a timely basis. What is also interesting, Mr. Speaker, at a time when we're talking about obesity and telling persons how to eat during COVID-19, persons are more domiciled or at home, and they're doing as much exercise as because of the restrictive covenants and the executive orders. There have been those who would say, well, who've said to me in no uncertain way, like they said to the member for the Exuma, many persons are vegans, or they eat certain food products because of their religious or cultural reasons. And they would have asked for vouchers to have been extended to them instead of just having a food package prepared for them. And I'm simply asked why we couldn't have given many persons, even in the family islands, a $50 or $100 vouchers on a more sustained basis. And I even go further. I made this mention of this East Grand Bahama during the budget debate. As a proud island boy, I think the RISE card was something that made our people feel so good about themselves. Nothing in the world makes the poorest among us feel less than when they have to open up a voucher and sign, and you got to look for the manager to sign it. I think the former member for Yamacraw and the efforts with that IDB program, I think it's something that we should continue to look at closely because it makes our people feel. I said the former member for Yamacraw. I said the former member for Yamacraw. You have a good farm. You have a good farm in the front of my house. I'll commend you for that. Okay, you have a good farm and it's growing. So leave it like that. All right. And so I still think we should look at that program because it gives our people a certain sense of pride, Mr. Speaker, during these very challenging times. School repairs for our family island communities in particular. I would think that we should find a way, since we've all been affected across the board. This is not the member for South Beach. This is not his way. The good deacon will not do certain things in a certain kind of way. But we all have some underlinks. I've not been in the seat of power like you are, South Beach, but I know that and I hear the whispers. I have good friends who are sitting there right now. I'm looking right in front of me. I have two good friends there who sit in the seat of power. I would hear their conversation now and then eavesdropping. Well, what I'm saying to you, and they do some things to me also. I'll leave that like that. And I'm saying, let's ask those who would be disbursing or allocating those assistance for the school repairs, as the member for Kalani goes to Andros, to give others a little chance to survive also. All of us make up the communities of Andros, Eleuthera, the Abacos, Grand Bahama. Everybody got to live. That's what I'm saying. And, and we must be inclusive. PLPs, FNM, DNAs, or all those other unnamed parties, all Bahamians get hungry. That's what someone told me the other day. So all Bahamians get hungry. So I'm simply saying to those who, when you're powerful, be merciful. And I'm saying to my people out there this afternoon, for those especially who are disbursing those much needed repairs to school as we get ready for October 5th, they seem to have quite a bit of cash at hand in these contracts to assist. And I tried my best. I'm not saying I can't speak for everyone who's on my side when we were in government. I tried my best with the bus contract and everything else to try to be across the board to assist on both sides. Because I realized at the end of the day, one day for me, one day for you. That's the way this process goes. Mr. Speaker, I must say that this government has made a lot of grand announcements over the years. The commercial enterprise, the overhead initiative, and I've seen the developments. Some things are happening. Grand Bahama Tech Hub, Port Lukai, we thought would have been flourishing by now. Lots of announcements, and over $3 billion would have been borrowed just over 3 years. But at the end of the day, our people are still this afternoon very, very challenged, living from hand to mouth. Like a lady said the other day, with all this money y'all would have borrowed in that parliament, how come we can't touch and feel more of the things from which y'all would have borrowed these monies? I put it to the governing side. Our people will want to touch, feel more from this money that would have been borrowed in the name of the Bahamian people. Reasons given for the resolution to be extended to the 31st of October are, but not limited to, having regard for the proliferation of cases in neighboring territories and jurisdictions, and active cases and deaths in the Bahamas, securing public safety, defense of the Bahamas, maintenance of public order, suppression of mutiny, rebellion, the list goes on, maintenance of supplies and essential services for life and well-being, has led to the need for the extension. This is a part of the justification process by the competent authority. But before I get to my next point, I must say this that comes to mind. I want to commend, as I stand here this afternoon, Mr. Speaker, as you are a man of the cloth, and I am an associate of the cloth this afternoon, Mr. Speaker, then I want to commend the effort of one Reverend Dr. T.G. Morrison, the pastor of the historic Zion Baptist Church on the corner of East and the Shirley Streets. A man who never flinched in his belief of the church state. I'm just wondering, this good man of good conscience, and there were many others who would have stood over the years and given advice and admonition to the Progressive Liberal Party while in government. And many of you can vouch for these. They would have seen their comments in the daily editorials, various newspapers, on social media. And they would have talked about what was right and morally reprehensible. And I'm wondering, where are these good archbishops when there would have been the lockdown and the churches being limited, and all the members would have been crying and asking various questions because of the restricted covenants of the executive orders. And many other things that have been happening in our society. And I'm not afraid, because many of these are my friends and they would have prayed for me. And I'm saying to them, you can't be given good advice, saying what is wrong with our society, morally and otherwise, when the PLP or the Progressive Liberal Party is in power, but when it's the governing Free National Movement, you can't see nothing wrong, but you can't see any comments from you. And so that is something that the Bahamian people has been taking note of. As a matter of fact, another religious leader who I never thought support our side was one who brought it to my attention. So I'm just saying that I'm saying to my friends out there, be careful what you say, because everyone is watching, especially those in the forefront of the battlefield for the Lord and Savior Jesus Christ. I must say, the religious bodies must be minded, and many are upset. The underlings are upset. Maybe not those who are not so prominent, about the barrooms virtually having some level of latitude. Super Value is congested. The washouts are full. But when it comes to church, the numbers are very restricted. But I thought I would mention that. I listened to the member for Kalani, who leads the competent authority. 10 persons at graveside, maybe 30 in the Family Islands now. But most importantly also is we're having some level of new freedom that he announced moments ago. What has been most disturbing, and I was glad to hear it, especially about Andros. I can talk with my district. When Family Island businessmen, Mr. Speaker, returned to the islands, they would have tested in New Providence. Somebody would have asked to purchase a ticket to get a quick test in New Providence, that is the PCR test. And then they get to the islands, Inagua, Mayaguana, Andros, Eleuthera. Then they must be quarantined for 14 days. Unbelievable. This, Mr. Speaker, was a very hurtful process to go through, and I'm glad that we can be seeing some light at the end of the tunnel relative to this matter. Mr. Speaker, there are many who see the emergency orders as being heavy-handed in the governance process. And scores of Bahamians have made their comments known on social media, the various newspapers, feeling as though their civil liberties would have been infringed upon, and saying this is an overreach by the governing side. I am simply asking this afternoon, as those who would make their comments and they're not afraid to speak their mind, why hasn't there been more free COVID testing for what we call over the hill or these heritage communities, where we have very large pockets of our people living every day? And sometimes we talk about them in such high regard and how we want to protect them. Why haven't they been given the free test, especially in what we call the heritage or the more congested over the hill communities? They're also, on the other side, Mr. Speaker, they're also Bahamian, especially men, and being fair, who would have tested positive, gotten their results, and returned home and were never honest with their families and letting them know or relaying the message that they would have tested positive and needed to be quarantined. And so we've heard these stories also. So there's a level of culpability also that we as a people must accept. I want to especially this afternoon pay tribute to the workers in my district, the healthcare workers, the clinics in Mangrove Key, Johnson's Bay, and in Fresh Creek, Andros, and also to thank island administrators, Ingram and also Lightborn Shanrose Thompson in Central Andros, for their great work in leading these efforts, along with local government practitioners and chief counselors, Nemor, Zebedee Roll in South Andros, and Pastor Keith Robinson in Mangrove Key, along with local government practitioners and other religious leaders in these communities who've been leading the charge in this effort to keep our islands and their spirit and morals high during these very challenging times. COVID-19, Mr. Speaker, has also led to much bereavement in our society. And I want to say a special good afternoon to Apostle Dorinda Dean, whose granddaughter passed just after childbirth, due to complications with COVID-19. I must say that her, along with scores of, I think, just about 70, almost 80 other Bahamians, and others, I guess the assessment has not been done. The postmortem would not have been done on their deaths and everything else. But there have been others who this afternoon we are concerned about. And some are asking the question, why do they have to die? And the list goes on. You heard from the member for Bambutang earlier. But I'm saying to Bahamians this afternoon to be vigilant. Mr. Speaker, since COVID-19 outbreak in Wuhan in December 2019, it has spread across every corner of the world, including developing and low-income countries. For example, just this afternoon, Brazil reported that it has some 3.5 million cases, over 100,000 deaths. India, 3 million cases, over 50,000 deaths as of August 23rd, 2020. The United States of America, just over 201,000 deaths this afternoon and over 6 million cases. In the Bahamas, we saw the latest statistics, 3,418 cases, 75 deaths. The minister will give an update as you heard earlier today. Clearly, we in the Bahamas are very concerned because the issue of comorbidities is a big issue for us in the Bahamas. And we will have seen the reports from the CDC. Therefore, I stand this afternoon as one who represents a family island where sometimes older people, we have a very generally older population and a younger population in many family island communities. I would want to warn my people this afternoon to be very guarded, be very careful, especially if we have any of these concerns or health concerns that they would have listed. Hypertension would be called high blood pressure. Diabetes would be called sweet blood. Obesity, which is a little heavy. Cardiovascular disease, asthma, what we call shortness of breath, chronic kidney disease, cancer patients. These individuals, among many others, need to be very careful with persons entering their personal space. And sometimes you need to be less accommodating in some instances. This is real. Family island increase in the COVID numbers is a major concern to me as an island boy. I do not have no sense of good feeling when I see the numbers in the family islands go up. Be it Inagua, Eleuthera, Grand Bahama, anywhere. I would want to see the numbers in the family islands. No pun intended, I reside and live in New Providence. But as an island boy, I know how difficult life could be for basic health care in our family islands. But prayer, and God has been there, especially protecting my constituency. God has been there with our people, especially from Love Hill to Mars Bay. And that God has also kept us from Mars Bay to Morgan's Bluff, inclusive of the area represented by the good member for North Andros and the Berry Islands. That God. They continue to live by faith. And I was grateful the other day, Mr. Speaker, when Pastor Kareem Black of the Bahamas Conference of Seventh-day Adventists asked me to join them in a Zoom church service in my district, along with Pastors Ashley Brown, Pastor Robinson, Apostle Elijah Ferguson, Reverend Coakley, and others, as they prayed for the community and God's protection, which is so critical. And also the Christian Council in Central Andros would have done the same, headed by Apostle Dorinda Dane. They still believed that God is able. As we have all the trepidation and concerns and people are reticent about COVID-19, no matter what, God is still able to deliver us from this fiery dart this afternoon. Worse is still yet to come, many have been saying, as we await the vaccine. But I still believe at the end of the day, it's good to hear the announcement for the member for Kalani. I think we've got to learn to some degree to learn how to coexist with this virus. I am not saying to our people in no uncertain way to let your guards down. You can't be partying and carrying on, doing all kinds of things. I mean, it's good to hear the member for Kalani. I am saying, he did a family drive 2 evenings before sunset. And it's interesting, he mentioned what he saw, I think he said in one of the farmlands in Abaco. But mind you, Lord Abaco, right on the corner where the member for Kalani headquarters is, there seems to be some bar and they go down on that slope right there. And plenty cars and people there every evening right in the middle of the road. Police got to see them, and y'all know I'm historian. Police got to see them there. And young people and no mask on, right on the band there. Member for Kalani, Mr. Speaker, his headquarters is across here. He knows what I'm talking about. And all those people, I wouldn't put that on him this afternoon, but all those cars are right there. I say, hold on. The police, you see, I'm going out west. If you go all the way around by Clifton and over, taking a little ride, a family ride. I say, hold on. Someone got to see all these cars, all these young people standing up here. And you get out here by the Tiki Bar in that area out here out on West Bay Street. Them young people that got the bong thing, whatever they call it. I see about 15 or 20 of them. I said, man, we got to take this thing serious. And whatever it is, So I am saying to our people, we've got to be very careful. It is almost certain that the world economy is entering a recession of historic proportions. This afternoon, many would say. How bad it would get depends on how governments manage the COVID-19 pandemic. That's why our leaders must come together. And our leader would have sounded a precautionary note for the need for collegiality and us coming together in our Bahama land. We should all want to see our country do well, our people lives improved, and having basic civilities and freedoms being observed in an unencumbered way. But we must remain cognizant of the fact that the problem lies with us when we make certain choices and decisions. The big question we must ask ourselves, do we wait for the curve to flatten, or whether we flatten the prospect of a recession? That's where the balancing act, according to one reporter on Fox, was put last evening. And I like what he said, that's why he took it down. do we wait for the curve to flatten, or whether we flatten the prospect of a recession? And he said it's going to take what we call a symbiotic relationship. This one feeding the next one, moving in tandem, doing this together. I protect myself, I do this, you go in this environment, if you can work from home. And I'm glad for those public servants this afternoon, also the various corporations and government bodies that have allowed persons to work on rotations and staff coming to work in the morning from 8 to 1, some working in the afternoon who have local transportation, and others, and permanent secretaries who've been understanding and empathetic. That's important. When you could tell people, come to work 9 to 5, that's what the public service order says. That's being less than sensitive. And the buses ain't running all the time either. And some people have done it to people. But they told me, not all permanent secretaries would have a heart. And this ain't nothing unique to your side. It happens across the board. And so I'm saying to those permanent secretaries and directors and those who feel and are concerned about their local staffers, who've been able to work in a flexible way and do not hurt your staff and allow them. But I'm saying also to staff members, do not slack off. And so my thing at the end of the day, I'm saying to people, please, our people, be productive. And if you're given a task to complete at home via social media, complete your task. Don't tell your boss that keep on dropping down all that kind of stuff. You heard all them kind of stories too. You know, this could happen. There'll be some copying out. And you could go online and you can see all the various reports, international reports and what have you. People blame a lot of things on social media. If you had a task to do, please complete it and send it in to your boss or your division head and make sure it's done so you don't make everyone look bad. We must open our society responsibly and on a phased basis, I totally support, inclusive of the various stakeholders. Therefore, it would be unlikely for both of us so that we can all achieve what we anticipate in the Bahamas. And so it would be better for us to face those challenges this afternoon head on, rather than trying to ignore what really exists in our society. Food prices, Mr. Speaker, has gone up. Food prices has gone up. This is the reality. You get all the reports. Persons are going now with their bags to the food store and $200. The lady showed me the other day, virtually one bag. And unfortunately, the bag was red. I'm so glad it wasn't a yellow or a blue bag. It was a red bag. And she sold me a red bag with $200 worth of stuff, a bamboo tongue, and it wasn't full. So I said, that's where you get this red bag from? But I wouldn't say which MP she got the red bag from. I wouldn't do that, reveal that source this afternoon. But she had a red bag. That shows that someone must be monitoring this process. Also, many citizens this afternoon cannot pay their rent. And there are still those landlords who are threatening tenants in their various places. Others, the elderly especially, cannot get some of the medication that is needed. Others simply want to go to church and prayer meetings. So therefore, we must remember that we must be focused on dealing with these challenges that we face. But as we sit in this place, the government must simply remember that it's not a time yet, it might be for campaigning, but it's a time for pain relieving, to make life easier for our people. Simply, not a time for campaigning. Simply put, but it's a time for pain relieving for our people, to make life easier for our people. And this can happen through engagement, access, and national buy-in. As we are yet to await the completed Economic Recovery Plan 2020 from this government, the issue of parliamentary oversight is critical in this process. So therefore, the 30-day extension, as espoused by the member for Kalani, was challenging to us, because if you are loosening up all of these regulations and society is going to be open up, free domestic travel, international travel is coming shortly, why do we need another 30 days? Couldn't these come under the aegis of the member for Bamboo Town to the Public Health Act, for example, or the Quarantine Act, for example? So the whole issue is one, I'm just giving these things generally as a concern. I'm saying, people are, some of the questions that person have been asking. So therefore, we on this side are challenged by the fact that if you're going to be having all of these change in the executive orders, why do we still need 30 more days? So it gives us a challenge. So therefore, it's against that backdrop, we would anticipate at least 7 days, 14 days, or a fortnight. for us to give it our full support. In its present form, we're saying if we are pulling back on this, we're allowing this to happen, we're allowing that to happen, there's more freedom, why do we still need 30 more days? So we hope that we can reach a threshold or some understanding so that we can support, but in its present form, the opposition would not support, and I'm being guided by the deputy who leads our party this afternoon in this honorable place. We must build true consensus. Both sides have constituents to answer to. We must let all of our people breathe. Through the National Field Food Program, through opportunities, through stimulus packages, all of our people need something. Just like the man over the hill, the people in South Andros and Smithsville and the Bluff need a little something. Just like the well-off persons who would need further assistance in the Western District on Prospect Ridge, who would need their poles and their electricity supply to be properly done underground. Persons in the Family Islands also need their poles to be fixed. So I'm saying on both sides, all of us, white, black, yellow, or brown, we all need access and opportunities and protection under the Bahamian law during this process, and also as we fight this pandemic called COVID-19. I admonish Bahamians this afternoon as I take my seat, Mr. Speaker, to wear your mask, wash your hands frequently, observe the social distancing protocol. Let us fight this pandemic with all our will and all of our might. I look forward to the day when we can go back to the regattas and the church conventions. Wouldn't it be the good old Church of God or jumper convention where we could sing, having a good time up in heaven after a while and everybody feeling good? When we all get to heaven, what a day of rejoicing that will be. When you can go to a convention and feel free, a Josie Church in the Grove or somewhere. And if I can go to the cathedral to Synod with Canon Harry Bain, Venerable Harry Bain at the cathedral, and sing, and can it be? Amazing, amazing love, how can it be that thou, my God, shouldst die for me? Not having a mask on like Kalani. But it choked me to death as I sing in the Anglican mode, you know? So I want to be able to be free when I go to worship my God. So let's do this together. I am saying this afternoon, we are hoping for those days. As I take my seat, Mr. Speaker, I quickly look at the biblical reference, and this is something to be a pericope from Psalms chapter 33, verse 18. And it reads as thus: Behold, the eye of the Lord is upon them that fear him, upon them that hope in his mercy, to deliver their soul from death and to keep them alive in famine. Our soul waiteth on the Lord, for he is our help and our shield. For our heart shall rejoice in him, because we have trusted in his holy name. Let thy mercy, O Lord, be upon us, according as we hope in thee. And like my good friend, Pastor Alan Lee would have said, as I take my seat, Selah, think and act on these things. May God continue to bless all of you, my colleagues, and may God continue to bless the people of South, Central, and Manuguki, Andros, and by extension, may my God continue to bless the Commonwealth of the Bahamas.
Thank you, Honorable Member. It sounded like your association with the cloth has led you to the Lord.
Sure.
As many. Can I recognize this member for Centerville?
Thank you very much, Mr. Deputy, and thank you, members, for indulging Centerville at this time. I want to thank Fox Hill in her absence, the whip. She as always, she knows that I have school pickup around 3:30 and 4 o'clock in the afternoon. So she works with me to ensure that the time of my presentations are within the scope of that ambit. So I appreciate her for that. I also want to thank Nassau Village in his absence as chair and speaker. He has always allowed me some time to, during a debate, to deviate from the debate, because of course, I'm sure he would have understood as well. I may not be here for a member statement because I have to pick up my kids. So notwithstanding that, I assure you, Mr. Deputy, that everything that I say in this presentation speaks to Centerville's vote. For me, Mr. Deputy, Mr. Speaker, it's about democracy. It's about the management of democracy. Thank you, Mr. Speaker, as we approach the dangling the carrot season, and it is carrot time. It is always a privilege for me to serve and to represent the people of the Centerville community, and by inclusion, the people of the Farm Road area, which forms part of the Centerville constituency, and also by inclusion, the people of the Grantstown area, which was represented by my great-grandfather, the independent member of Parliament for Grantstown, H.N. Chipman, many years ago during another world pandemic. It was in 1919, which lasted in the colonies, according to history, for some 2.5 years before normalcy. I can only hope that the efforts and prayers of Centerville will forever embrace a spirit of resilience and national development, a spirit of love and care for the Bahamas and for the Bahamian people. Today, I rise in this honorable house to participate in a debate on a resolution to approve the continuance of the proclamation made on the 29th day of June until October 31st, 2020. Before I begin, I would like to ask the people of the Bahamas to indulge me, as it is carrot time, for a few minutes and to like our Facebook page at Centerville Constituency as we continue our jobs, tablets, and cleanup programs. It is at this page you can make any request of your member of parliament, and like others have experienced in our area, I will be there to assist. The Centerville Homework Group have been told that their homework for today is to listen to Centerville's presentation today in the House. They are the next generation, and we must prepare them for battle. Too much, Mr. Speaker, is at stake. Too many carrots. Carrot time has replaced the silly season. It's the dangling of the carrot season in the Bahamas, Mr. Speaker. Mr. Speaker, for consideration, I would have mentioned earlier. Outstanding petitions of this House, particularly the petition for the Ministry of Natural Resources and the investigation into the abuse of the Quieting Titles Act, have had no response from their respective ministers or the Statutory Instruments Committee of this House. I would like to suggest that open petitions remain on the agenda, much like open notices of select committees and unanswered questions of this Honorable House of Assembly. Today, Mr. Speaker, we would submit another petition of the people coming from Grand Bahama, where the Bahamian people feel disadvantaged by the high and unexplained cost of utility services being charged by the Grand Bahama Power Company. There are some concerns with regards to the obligations of ERCA and the impact of estimation versus actual demand. An investigation into utility cost, Mr. Speaker, I believe to be appropriate, as this would play a key role in economic development. But it's the dangling of the carrot time. That season of promises and no rewards. It's where the country takes the biggest risk of their lives, all based on this dangling carrot. Centerville will not be moved. We must, Mr. Speaker, take a very hard look at ourselves, how we govern, what and who are we governing? Are we or are we not better off as a republic? Will we or will we not listen to the rulings of the Privy Council or our justices? Are we unto ourselves legislative and enforcers? The begin all, end all, the Alpha and the Omega? Really? A lot for our electorate to think about, Mr. Speaker. A lot for our people to consider. A lot that only the ballot and the voting box can and will change. But our actions must be deliberate. We will be deliberate in voting out a system of political lawlessness, political classism, and political wannabes. No dangling carrots, Mr. Speaker. We will not be moved. And yes, we will be as stubborn as a mule. Today, I want to recognize, Mr. Speaker, some Bahamians whose passion for country, despite the odds, said, let me start something different. Let me explore the possibility of the real Bahamian dream, a possibility outside of the partisan FNM, a possibility outside of the partisan PLP. They took the road less traveled, a lonely road sometimes, but one filled with hope, filled with dreams, filled with passion and purpose. A road, Mr. Speaker, that was taken by myself as I challenged Mr. Christie in Centerville, where a community rose to the occasion and said no to the PLP and will definitely say no to this FNM. I want to acknowledge, Mr. Speaker, Sherelle Ali McIntosh from the Bahamas Constitution Party, Dr. Kevin C. King, leader of the Kingdom Government Movement, Mr. Garth Rossborough, leader of the PNC, the People's National Coalition, Mr. Cassius Stewart, leader of the Bahamas Democratic Movement, Mr. Wesley Campbell, leader of a party, DCNP, Mr. Omar Smith, chairman of the Democratic National Alliance, as well as Arinthia Komalafe, their leader, Mr. Paul Roll, the Coalition to Save Our Bahamas, and Mr. Mickelin Seymour, the People Righteous Kingdom Government. Wherever you see these people, these persons or their parties, let's encourage them to break the chains of separateness. Let's pray for solidarity as we approach the next elections. The Bahamas will vote as one. There will be no yellow Bahamas and no red Bahamas. There will be one Commonwealth of the Bahamas, one vote, one voice, one vision. Bahamas is going to be us or them. And the last time I checked, you were a part of and amongst us. Mr. Speaker, I truly thank you for your indulgence because this particular debate is just overly passionate for me. Centerville have done quite a number of things, and I just wanted to mention them quickly before I pivot into the vote. We do have a cancer and community awareness program where we are providing dumpsters in each polling division, and we have already started that. And I encourage Fisher Oliver and Ms. Williams in Mason's Addition and Fort and Castle Hill to continue to push towards community development through collaboration. Our community food assistance and rental assistance continues directly from the desk of the independent member of parliament. That has nothing to do with the government. However, the government's program, I've been told, will end shortly. Our job assistance program continues as we continue to hire as many as we can for as long as we can. And that again, from the desk of the independent member of parliament. Thanks to Beaches and Parks chairman for some contracts that were distributed to a limited number of persons in the community. We are thankful. We have been assigned.
It's about to leave.
Chair recognizes Donald Trump.
It's about to leave this issue alone, but as leader of government business, an individual tasked with protecting the reputations of my members in this place. Mr. Speaker, I take umbrage with the words used by the member for Centerville when he refers to members of this House as political wanted. Mr. Speaker, under Rule 33, I think 17, 18. That's what I heard. He said political wannabe. And if he's referring to members of this House, Mr. Speaker,
Which
then
order was that, Bambutown?
You know.
33.
3317. It's offensive. Because any member elected in this place is not a political wannabe. We're all members of a political party, duly elected by the Bahamian people. And so, I would ask that the member withdraw it. And if he doesn't withdraw it, then he's also, imputing it to himself because he happens to have been elected in this place. There's ways that we refer to members in this place. And
Thank you,
wannabes is not one of them.
Thank you, Member for Bambutown. My recollection is Section 18. I know we still have these books, these rules that we need to fix, so we wouldn't go there right now. But Member for Centerville, the chair would indulge you in clarifying the point raised by Bambutown.
Yeah.
Because it is a relevant point.
Yeah, thank you very much, Mr. Speaker. No doubt, by my very nature, it wouldn't be one of being disrespectful to anyone in here or disrespectful to anyone out there. What I did say, and I will repeat the section, I said a lot for our electorate to think about, but our actions must be deliberate. We will be deliberate in voting out a system of political lawlessness, political class system, and a system, I guess, that's what the trend was of political wannabe. Has nothing to do with anyone in here. Well, if you think you're the system, I don't think I'm a part of the system that I've referred to. Now, if you think you are, then that's fine. Excuse me, Mr. Speaker. Excuse me, Mr. Speaker.
Yes, Councilor.
Yes, that's so I just meant to say it was a system that I was referring to. Yeah.
Sorry.
Go on.
I think the member for Bambutown is implying
Right.
to the chair that, and even when I hear it in the context which you read it, that it could be implied, clearly implied, by members of this House, but more importantly, members of the public, that you're suggesting, and by your own words, that this is the place where we are, the quote unquote system, maybe implying that we want to be. So if you could just,
Yeah, I'll just wrap that up.
if you hold on,
Go on.
if you would just clearly clarify that I know you tried to a few seconds ago, that in fact that was not the case,
Okay.
and if it is, then that's yes.
Okay, Mr. Speaker, if it is offensive or disrespectful to anyone, first of all, Senator will apologize for that and withdraw it. Thank you.
Thank you.
Our
Thank you,
community, Mr. Speaker,
Thank you, Bambutown.
our community food assistance and rental assistance continues. Our job assistance program continue. We want to thank Beaches and Parks, like we said, and we want to thank the Minister of Works and the Minister of Education for their assistance with regards to the persons in Centerville. Plantal Street Park and the Culmersville Park well on their way. Plus tablets programs for the children, and those, again, Mr. Speaker, from the desk of the Independent Member of Parliament for Centerville. Just for reference sake, thanks for the carrot. Just don't dangle it. It means you're full of promises and sometimes mistruth. It means you have people running up and down promising this and that. And dangling my colleagues and Bahamas means you want us desperate enough that we have no choice but to vote a certain way. So because you gave us a little something, big risk, very little rewards. Mr. Speaker, Centerville would like to recognize quickly for our Centerville Thumbs Up Award that's also a prestigious and now a historical award here in the House of Assembly from Centerville. Mr. Andrew Allen, attorney and columnist, for his in-depth analysis on our socio-political framework and affairs. Like I'd mentioned earlier, Mr. Kai Mills of Abaco. Kai cares for his passion for his island and his Bahamian people. Mr. Pierre Depuch for sharing his wealth of knowledge and educating yet another generation of Bahamians to believe that we can. Mr. Roscoe Thompson for his acknowledgement. And last but not least, Mr. DeQuan Swain of Grand Bahama for his efforts in Grand Bahama for shedding light and his generational commitment to fight against unfair, unjust treatment of Bahamians. And y'all, or people, not your people, are saying that we don't have enough talented people to run this country. Well, Mr. Speaker, we have an entire independent shadow cabinet ready to get a grip of this country. We will govern with real accountability and transparency. Holding at that same time, managing our freedoms and the democracy of a people. No dangling carrots, Mr. Speaker, just carrots, carrots, carrots for our people. Now to the business at hand. Why are we here today? Another collaborative effort of the PLP and the FNM to make us believe they differ on a position. The competent authority was well in his capacity or their capacity to ensure parliamentarians participate in this debate, even if by Zoom. Most importantly, your very own library or broadcasting committee of this House could have assisted with this function considering the circumstances of this House. Rule 41, Mr. Speaker, in the rules book, it says, or otherwise as the House determines, which obviously means we are able to consider technology and COVID-19, even Dorian, with members on different islands. We must, Mr. Speaker, find a way to acknowledge the truth of democracy. The democracy of the Bahamian people is at stake. Are politicians in the Bahamas, Mr. Speaker, that afraid of democracy? Democracy may make them realize that they are not as intelligent as they make others believe. Will they realize the truth of this democracy, which will flatten their power curve? Will they realize that democracy will expose their unkind love for themselves and the impact of that unkindness on us as a people? God be with the Bahamas and God be with us. Both PLP and FNF, parliamentarians, politicians, you can tell from the public policies of their organizations. And this trickles down into their governance culture. Both parties flounder with the idea of democracy. You flounder with your ideals, and you flounder with the rights and human dignity of our citizens. One day you are saying, come here. Tomorrow, don't come. One day you say immediately. The next day you say indefinitely. What do y'all want from us? What do you want from the Bahamian people? Politics have politicized and mischaracterized our healthcare professionals to the point that we don't even know who to trust. Politics, Mr. Speaker, have compromised our unions, destabilized our churches, and no doubt you have miseducated our children and miseducated our people. Crime and corruption.
Yeah, the chair recognizes East Grand Bahama.
No, but you can't make those kind of statements, Mr. Speaker. It really is, quite frankly, insulting to this Parliament and every member in it. Who is you? What are you talking about? The member is also a member of this legislative branch, this House. Is he suggesting that that is the view that people should have of him? I don't accept that.
Thank you, East Grand Bahama. I was listening attentively also. I was about to caution the member from with regards to the words from Bamboo Town earlier. And I was listening, and I keep hearing saying political parties and politics. So I was listening, member for Senate, and I'm going to caution you again in your delivery, your choice of words, and how what you're putting out there, because it could fall within the rules very easily. Order 33, 17, 18, 10, that speaks to when offensive, abusive, and insulting words are used by members of Parliament, the House, or in committee. They shall be expunged from the record, the proceedings, order of the chairman. Senator, I can't tell you how to deliver your presentation, but however, I'm going to encourage you and quite, I'm going to say from the chair, be careful how you speak to this House and its members.
Okay, thank you very much, Mr. Speaker.
Yes, characterize it now.
Thank you very much, Mr. Speaker. But and like I said to you, I said to the House earlier, this particular debate is just one. When I look at what's going on in our country and being in the position that I'm in, it's really hurtful. It's offensive to the people.
Yes, I understand that.
And
I
no,
understand that. But I just remind you
I
again,
finish?
there's also a section. No, I'll let you finish. There's also a section that I think is very important and relevant. The imputation, improper motives, etc., and personal reflections on members. And so when general statements are made like that, then you're improving reputation of this house and the various individual members, and as the members have included yourself. So while the chair does understand your passion and how you might feel given what happened over the few months, again, I'm just gonna say, I can't tell you how to deliver your presentation, but be mindful of the rules, all right?
I understand, Mr. Speaker, and I appreciate the comments, and I will be guided in terms of delivery. You know, when you get to this point after 3 years of asking for reports and all these different things, you know, you get passionate about whether or not anything will go right for the people. But I understand, and I'll try to calm myself a bit with regard to my passion for the Bahamian people.
Choice of words.
Thank you. Thank you. So, no doubt, I believe that politics has miseducated our people and our children. Crime and corruption has become commonplace in our country. Education, Mr. Speaker, has become a privilege, not a right. Healthcare, a disaster. And our people, many are intimidated, but yet they try to remain fearless. Mr. Speaker, the American dollar has become quite scarce. I don't know about you, but I hardly see any of them. When you see the resurfacing of the $1 bill with the Queen on it, you know we're in dire straits. Mr. Speaker, when you see that orange $50 bill, which you haven't seen in 4 years, you get upset, you get passionate about something. Mr. Speaker, when you see that square 15 cents, you know that people are going into their kidney to try to survive. And that's what I'm talking about. And so if I have offended anyone, and I've even put myself in that position to reflect on what I believe politics has done to us over these many, many years, I apologize to them. However, they must see a different future and a different plan for this country. And if they don't see that, then I'm sorry, I'll be beating down that system until. But the resolution, Mr. Speaker, tabled by the member for Kalani, seeking to extend the order. The extension also of the competent authority until the 31st of October. Centerville had asked for, and I just mentioned this already, House Rules Report, Public Treasury, State of Public Treasury, Public Accounts Committee. You come in here every day. I wish I could say, child, please, like Mr. Ingram, but I'll pass on that. The people are still waiting on an answer from their petitions. You see, Mr. Speaker, when you come to this house and when I come to this house to represent Centerville, and I believe that my people will be better off for what I am attempting to do in terms of structured governance rules and trying to live up to those. It hurts. It hurts to see what goes on in here. And it's discouraging. But what keeps me going is the people of Centerville, because they want me there, and they will keep me there. Mr. Speaker, the Land and Surveys Board, I don't think they met, but yet we've had all of these different communications with what is, what isn't, what should be. We have some unanswered questions, Mr. Speaker, in your book. I mean, it keeps our agenda book very thick. I mean, then maybe just a simple answer could help our people to move forward and progress. Mr. Speaker, we have more than 10 healthcare statutory bodies and committees with more than 10 healthcare pieces of legislation, along with a Disaster Preparedness Act that has yet to be referenced or a report issued in their accordance as it relates to this pandemic. And we are still asking for an extension. Mr. Speaker, I have a list here of all of the boards and committees and the names of the people responsible, and even the health laws that we are supposed to be encouraged. Even with the health laws, there's even one called the Vaccination Act that I didn't know existed, but it's here on our books, and so I don't know. You know, maybe that's something I guess that I myself, would look into. But just to deal with the debate at hand, my fellow Bahamians, it's dangling the carrot time. Yes, this is the carrot season. When they come to your house, they will not discuss how important your vote is to the next generation. They will talk about menace and brave. Really? They'll talk about one choice being better than the other. Really? They won't discuss how many people have died in Dorian. They won't talk about the local impact of COVID-19 on our healthcare system and our economy. They won't speak to the high cost of living as a result of the VAT increase. They won't speak to rental assistance, jobs, debts, the TMH. They won't talk about the cost of education, land theft, and greed. They will come with a carrot dangling. And Mr. Speaker, when I bought this carrot, I was a little apprehensive about bringing it because it could mean so much. You know, but okay, I'll tell you what it means. And since I have a couple of times, you know, the dangling the carrot. Here, police officers, we will give you a raise and a promotion, but inadequate health and pension coverage for your families. Here, Mr. Churchman, we will give you a piece of crown land, which may or may not happen within 20 years. Here in the city, we're going to build you one park and a low-cost house, maybe, or move you into a government complex as we give away your family land. Mr. Speaker, that's what I speak of when I talk about dangling the carrot. We need to be honest with our people. Here, constituents of Kalani, we'll fix that seawall in that road. As a matter of fact, the seawall is eroded today, just of some water. And I don't know why they keep, it seems like every term or election term, that seawall has to get fixed. But here, constituents of Kalani, we're going to fix the seawall and the road while our homes are up for sale and our children will not be able to complete their degrees. Here, fishermen, we will stop the poaching and let you regulate the industry while we ensure that your legislation discriminates even against you. Here, elderly, we'll add you to the social services program, but will not increase your pension or provide you with better health care. Here, young people, we'll give you a job. You say you want a government job? Done. Our young people cannot even afford the data that they need to be educated. Here, parents, we'll build better schools as these mold-infested schools continue to play a role in how sick our nation has become. Here, MPs, we'll run you in the next election, and then you'll be in the cabinet. Here, cabinet, you'll be set for life, but you need 2 terms. How in the world do we fall for this? For every time, Mr. Speaker. Why? Why do we fall for this? You see, Mr. Speaker, we are made desperate enough as a people even around this time. And we miss out on the biggest opportunity to change our way of life for the betterment of all Bahamians. Centerville did a survey of our community, and we continue to compile data in this regard for COVID-19. Centerville feels disenfranchised when it comes down to adequate health care, but they understand our plight. Mr. Competent Authority, Centerville sees no benefit in extending your powers. Your arms are long enough. We saw no benefit in increasing the VAT. We saw no benefit in your conflicted post office lease. We saw little benefit in your Over the Hill program. We saw no benefit in terms of legislating on behalf of the Bahamian people. Many are too busy, Mr. Speaker, and I hope this is said, I don't want to say things in a way that, I don't know, I guess Parliament does have a language, and I need to adapt to that. And maybe that language is outside of the passion of people, but we'll continue. Many, Mr. Speaker, are too busy trying to fit into the political class, a sector quickly deteriorating. It reminds me of what Sir Randall said to Sir Lyndon when he left to be independent. He admonished Sir Lyndon, and he said Sir Lyndon was working on being accepted rather than the revolution that was needed for our people. This government, Mr. Speaker, has far strayed from nationalism and has traded it for institutionalism. Unfortunately, that came with generational curses and attributes. Only time will tell which one outweighs the other. Centerville does not support the extension based on the above as indicated. However, we wish the government the very best in terms of protecting this country and its people from a world of capitalistic monopoly and the devaluation of human beings and the devaluation of the Bahamian people. Thank you, Mr. Deputy Speaker, for your indulgence. Thank you, members. Thank you to Centerville, and may God continue to bless the Commonwealth of the Bahamas, for which we will continue to stand, one people, united in love and service.
Thank you, Senator. As many. The chair now recognizes the member for Elizabeth.
Thank you, Mr. Deputy Speaker.
But no, who the cap fit, you let them wear it, that's all.
I rise today in this honorable place, humbled and grateful to represent the tremendous people of Elizabeth. They are one of 39 constituencies in this sovereign democratic state. We have one of the oldest democracies in the hemisphere. The Bahamas has enjoyed almost 300 years of continuous, peaceful democracy. The Speaker said 291 years this year. And over the last 3 years, I've had the opportunity, privilege, pleasure, because of the people of Elizabeth, to serve in this place. It's an honor and a privilege that I take seriously and for which I am grateful. Tomorrow is promised to no one. I may not get the privilege to serve in this place again, or with their support, I may. But I truly hope that on that great getting up morning, when we are all asked to give an account, that I was found not wanting in my service to this great country. Martin Luther King Jr. said that the ultimate measure of a man is not where he stands in moments of comfort and convenience, but where he stands in times of challenge and controversy. Today is one of them days of challenge and controversy. As I look around this place all day, there have been some 16 members of Parliament present in this place. For many months now, this house, the People's House, has been less than full. Constitutionally, it was envisioned that no less than 38 honorable men and women drawn from the people would be serving to represent the interests of those people. That decision was made in 1973 when the population of the Bahamas was 181,000. We're at about 390,000, give or take. Now, the reason why this House is sparsely attended is not because members do not wish to be present, but it's because of this virus, COVID-19, also called SARS-CoV-2 or the novel coronavirus. It is also because we have adopted a series of emergency orders, which are constitutionally justified through Article 29 to deal with a national emergency. In response, life as we know it in this great little country has changed with lockdowns, shutdowns, and close downs. I have close friends and family members, very close family members who have been infected with the COVID-19 virus. And every day for the last few months, I have provided direct patient care to COVID-19 infected patients. Some of them have improved and gone home, and some of them, unfortunately, have died. In response, life as we know it in this country is different. Weddings are different. Funerals are different. Interaction with friends and family is different. What has happened, however, is that there has been inconsistent application of rules and regulations depending on jurisdiction. What I mean is that rules and consequences that apply to one jurisdiction may or may not apply to another region, island, village, settlement. Look at the response to the increasing number of cases of COVID in Grand Bahama and the subsequent lockdown and the different approach on New Providence. Grand Bahamians, already in a challenged economic environment, were shut down. New Providence was not. Why the inconsistency? Compare the COVID-19 cases as of September 22nd in Long Island, 12, to the number of cases in a huge island, Andros, 5. Why does a person returning to Long Island not have to quarantine, but someone returning to Andros does? We have shut down domestic travel to the Family Islands. And this has had a deleterious effect or impact on already struggling Family Islands and Family Islanders. Have we truly sought the advice and guidance of the representatives of these people? South Eleuthera, South Andros. There are repercussions and consequences, some intended, some unintended. But such a national emergency ought to have demanded the guidance, scrutiny, and the input of the people impacted or affected, not less so, but more so. Particularly if we are, as we have, modified or adjusted the freedoms and liberties of ordinary men and women, we should have sought to ensure that this House, which has weathered wars, storms, plagues, and pestilence, remained open, fully open. Not necessarily on this site, not necessarily in this form. Countless countries have responded to this pandemic by embracing technological solutions to the new reality of COVID-19. Some hold virtual parliaments. Some have hybrid meetings where some people are in the precincts and some are participating on their laptops or computers at home. Others have set up parliaments in safer venues. Why haven't we, Mr. Deputy Speaker? There is no mention in our Constitution of the size, the location, the color, or the character of the place
where these peoples meet, where the people meet. This is the people's house. Irrespective or independent of COVID, this place and that other place are no longer appropriate for the needs of this great country. And if we add a potential health hazard, I remind through you, Mr. Deputy Speaker, all members, that every day in this country we hear of this facility or that facility or this ministry or that ministry being shut down. We ought to be setting an example for the public to follow. I endorse the honorable member of Kalani's statement that wearing a mask saves lives. But the wearing of masks should start in this place. And we should all wear masks all the time. Mr. Speaker, I am reliably informed that we have 39 MPs, 17 staff members, and 16 senators. And to date, 6 staffers or MPs have been stricken with COVID-19. That's 8.3% of the staff and members of Parliament. That cluster of cases confirms that we are challenged in this ancient edifice because it amounts to some 10 times the national average. And if you do the arithmetic and look at 3,500 cases and 390,000 people, you get a percentage rate of about 0.86%. How many more of us should be infected before we act? Many of us, like the population, have comorbidities. Some of us are older than others. And while we are individuals, we hold offices. And even if we are willing to risk our individual health issues, we must protect the offices and the institutions that we are privileged to serve. This is not about us. This is about this country and ensuring that this country and the instruments of governance and government can continue without interruption. This reality ought to push us to an alternative venue or platform, and we should do it now. We should have done it sooner. We have not adopted a technologically appropriate solution, whether that's Zoom or anything else. In the face of the greatest challenge to the survival of this country, in the face of the greatest economic downturn since the Great Depression, in the face of the single greatest public health threat, Parliament, because it cannot function normally, in my view, has surrendered the power of the people. Now, not only have we surrendered the power which we have pledged to protect, but we have doubled down and we have concentrated it in the office and person of the competent authority, because it certainly appeared as if that was the right thing to do. 6 months later, actually almost 7 months later, we can no longer describe the situation as an emergency. An emergency is defined as a serious, unexpected, and often dangerous situation requiring urgent action. This has now carried on for some 10 months, and it is the new normal. So just like climate change, which is not an emergency, but it is serious, it is a new normal. Just as inadequate food security is not an emergency, COVID-19 is a new normal. I seconded the resolution for the first emergency order. I was proud to do so, and I would do it again. We had good intentions. We expected to bring the spread and impact of COVID-19 to a halt. The framers of our Constitution did not make a specific provision. They did not imagine it. But here we are, almost 10 months into the new world reality, to debate a resolution to extend the emergency orders. By their very nature, they upend liberties and the rights of our people. They were and they are draconian. Desperate times call for desperate measures. And so the question today, Mr. Deputy Speaker, is should the emergency orders be extended? A bit of history. When we talk about draconian rules, we talk about Draco, who was the first recorded legislator of Athens in 7th century BC. Now, draconian laws typify harshness. I supported the draconian initial emergency orders. I believe then, and I believe now, that they were necessary. They were constitutionally sanctioned means to achieve an end. We had good intentions, but as they say, the road to a certain place is paved with good intentions. You see, we are a democracy, Mr. Deputy Speaker. The power of the people is vested in a minimum number, no less than 38. In this place, we are addressed not as Dwayne Sands, or Peter Turnquest, or Jeffrey Lloyd, or Vaughn Miller. Rightfully, we are reminded that we represent thousands of persons in Elizabeth, or East Grand Bahama, or South Beach, or Golden Isles. And that is how we are addressed, to remind us that we are here to represent people. Even with the emergency orders, the framers of our Constitution envision a balance of power shared by the executive, the legislature, and the judiciary. And while not explicitly enshrined, it was imagined that each would check the other, and the fourth estate would hold us all accountable. What we have not done, what we have done, at first for good reasons, is to consolidate power not into 39, but into one. What we have done is to weaken the power of the 39 to provide checks on the one. We have seized the power of the people, possibly, and this requires legal opinion, in defiance of the Constitution. The expectation was, the hope was, the prayer was that there would be a more efficient and effective approach to the emergency. The proof of the pudding is in the eating. We have surrendered the people's power, and what have we gotten? And all of us, all 39 of us, are here for this time. Our people are looking on. Many are saying they cannot breathe because of financial pressure, the challenge of feeding or educating their kids. We have historic levels of unemployment or underemployment. Businesses are stressed. This is a time when all good men and women must participate in a meaningful way as members of a team in the affairs of the country. It is not a choice for those of us who have been elected. It is our sacred duty. So what then do we do? Elizabeth will not support the extension of the emergency orders because there is no apparent or justifiable reason to do so. There has been no specific reason to continue the unfettered power, not just of the executive, but of the competent authority. Do we extend indefinitely? Based on the definition, we are no longer in an emergency. This legislature can pass a sunset law saying that until December 2021, that we will require social distancing, the wearing of masks, etc. We must make choices. Our strategy must be bold. As of September 22nd, 2020, more than 967,000 people have died around the world from this virus. According to Johns Hopkins University, there are more than 31.5 million confirmed infections. And there are likely many more because many persons, particularly those with mild expression, and it is believed that as many as 40 to 45% of persons infected with COVID may be asymptomatic. Contagious, but asymptomatic. 6 months after the discovery of this novel virus, the Bahamas had lost 11 souls, and we had 103 confirmed cases. We were relieved. By the end of April 2020, we had flattened the curve until mid-July, when the cases started again at a horrific clip. And just 3 short months later, we have recorded 3,467 cases, and we have 77 COVID-related deaths confirmed, with an additional 20 under investigation. Of the 213 countries or territories, the Bahamas ranks 136th in total or absolute number of cases, with 3,467 cases. But in terms of number of cases per capita, this little country ranks 36 in the world. That's 36 out of 215 countries or territories. We have a case incidence rate per million, which is twice the average of all countries in the world. 8,797 per million, as compared to an average of 4,075 per million. We have the 38th highest incidence of deaths from COVID-19 in the world per capita. So notwithstanding the noble intentions, the hard work, the resources expended to date, we are not winning this battle. And we have paid an incredible price to this date. Our economic performance, although ably guided and managed by the member from East Grand Bahama, is facing hurricane force headwinds. Let me compliment the efforts of the executive. Let me compliment you for the work that you're attempting to do. Businesses like gymnasiums, and I'm happy to hear the member of Killarney say that they will be allowed to function, and restaurants are struggling for survival. I could continue. But the bottom line is, if the treatment is worse than the disease, then perhaps we ought to change the treatment. I want to pivot now and talk, as I get ready to close, about testing capacity. The Bahamas has done a much better job with testing. We've done some 17,341 tests since the start of the pandemic. Those are RT-PCR tests, which puts us at a very healthy 44,000 per 1 million. We have embraced the private sector, who have done some 10,000 of those tests. But we are still not testing enough. Some 25% of recent tests have been positive. Aaron Bromage, a comparative immunologist at the University of Massachusetts, posits that adequate testing and tracing is taking place if positive test rates stay at 5% or lower for 2 weeks or more. We are still testing positive at 25%. We are not testing enough. Widespread random testing will allow us to approximate the 152 tests per 100,000 suggested by the Harvard Institute experts to be a safe level for reopening. For the Bahamas, that equates to 600 tests per day. 600 tests per day. You see, diagnostic testing for COVID-19 is critical to tracking the virus, understanding the epidemiology, informing case management, and suppressing transmission. We have appropriately and reasonably relied on RT-PCR testing, but I call today for the Bahamas to embrace antigen testing as a far cheaper alternative to RT-PCR testing. Not as sensitive, but certainly a $20 or $30 test, which can be supported by RT-PCR testing, which runs anywhere from $120 to $480 a test, may make it easier for us to control this pandemic. Saliva, yes. While not as sensitive, they can be game changers without some of the challenges of the first and second generation antibody tests, which I do not support. for diagnosing COVID infection. Let me say it categorically. Without a robust and consistent ability to test, definitively screen, isolate, and track, we will lose this battle. In June, I said, if we take our eye off the ball and lessen our vigilance, we can and should expect a second wave of COVID-19 in the Bahamas. I also said, if that happens, I dread even considering the potential economic peril. Unfortunately, our fears have been realized. So, Mr. Deputy Speaker, let us identify a suitable means for the legislative branch of governance to take its rightful place alongside the other pillars of government. Let us identify a temporary or eventually a permanent new venue, or let us move to virtual parliament. Let us run this country in such a way that the people are not deliberately disenfranchised. Elizabeth believes that no man, woman, or child should ever be slave or bondsman to another. And the party of Wallace, Whitfield, or Isaacs should limit any claim that we have curtailed or restricted the participation of any citizen in his or her affairs. I want to close and speak a little bit about vaccines. Yesterday, the Director General of the World Health Organization, Dr. Tedros, said that there's no guarantee of any COVID vaccine being developed. There's no guarantee that a COVID vaccine being developed will work. In order for us to be able to provide vaccines to the public, it goes through a series of phases. Phase 1 is the testing in non-human subjects, or the preclinical testing. Phase 1 is you're testing doses on healthy volunteers, and that you're looking to see if there's dangerous side effects. Phase 2, the testing of the drug on participants to assess efficacy. And then phase 3, testing on participants to assess efficacy, effectiveness, and safety. Any vaccine that should be delivered to the Bahamian public should be proven to be safe and effective. There is no vaccine that will be available anytime soon that would have completed this rigorous safety check. I support vaccines. They have saved many, many lives, but we should not use any vaccines which have been rushed, and particularly if it's been rushed because of a political imperative, and I'm not talking about a local political imperative. Mr. Deputy Speaker, it is for me an honor to serve in this place. I realize that these are difficult times and that there's much work to be done. We are no longer in an emergency. COVID will be with us for the foreseeable future. For that reason, and for some of the other reasons that I've outlined, Elizabeth will not and does not support this extension. Thank you, Mr. Deputy Speaker.
Thank you, Mr. As my chair recognizes the member for Golden Gate. 1 second. On the point of
Order. Yes. Misleading or leaving a misperception, perhaps.
pardon me,
Misleading or misperception. I'm not so sure that the member intentionally misled, but the member initially indicated at the outset of his presentation this afternoon that he spoke to the Constitution, and the Constitution requiring 38 members at a minimum of this House. And that is correct. The Constitution does speak to that in chapter 46, talking about there being at least 38 members. But there's an important note, because we don't want to leave a misperception that 38 members have to be present. The Constitution does not say that. In fact, the Constitution itself recognizes the theory of a quorum. And the Constitution speaks to a quorum of this august body. And it says in chapter 57 that a quorum of the House of Assembly shall consist of 10 members, including the person presiding, which means that including the Speaker 9 members otherwise are required for this business to carry on in this chamber properly pursuant to the same constitution the member just spoke about. That is in the same document. The same document.
I'm just
And so I think it's important that we don't have a misperception in the public that what we are doing here, as he mentioned, with 16 members, not 38, that there's something improper about it. And we are quite able to meet with a minimum in this chamber of 9 members plus the presiding officer. And I just want to make sure that that was clear, because that might not have been clear from the member statements, because he did not mention a quorum. And we have had a quorum at all times. Secondly,
Before you go on the second point, I'm not, from my perspective, I'm not sure if I got that from what the member for Elizabeth said, but
that's what I'm saying, and I'm sure it wasn't intended, but it's just been a misperception, potentially. Secondly, the member mentioned several times that it's been 10 months. And as I recall, the first order was March 17th. And as far as I recall, from my reading of the months, that'll be April, May, June, July, August, September. So that is 6 months. And at most, to this day, is 6 months and 1 week. It is not 10 months. We have not been down this road for 10 months. It has been 6 months and 1 week. And I just want to make that clarification. Thank you.
thank you, for Golden Gate. I don't know if it's. I see Elizabeth is
I want to thank the honorable member for Golden Gates for his questions and remarks. Through you, Mr. Deputy Speaker. Yes, you're 100% correct. The first emergency order came in March, and so we are just about 7 months. The pandemic, however, started at the end of December in Wuhan, China. That is where we get the 10 months from. If I have if you misunderstood my comments or if I was not clear enough, I apologize.
Thank you very much, Elizabeth. Asmedi. Chair recognizes the member for Golden House.
Thank you, Mr. Deputy Speaker. I rise and I stand on the shoulders of those persons who elected me to represent them. And for that, I am indeed grateful. I give honor to Almighty God who has made it possible for all of us to be here. I wish to speak briefly to the resolution. And that's not a preacher's brief, it's a brief.
Yes, Golden House, but before you commence the meat of your speech, just 1 second, please.
Honorable member for Golden House, you may continue.
Thank you. It was Mark Twain who wrote, and I quote, he said, "Loyalty to country always. Loyalty to the government when it deserves it." And so I came with an open mind. I came to listen and to listen carefully, and then to decide whether I should support the initiative, this resolution with regards to extending to the end of October or to not do so. Mr. Speaker, just briefly, as I've stated earlier in this place, reference to the impact of this pandemic on us as a country, as a people, and particularly all of us can speak as members of Parliament for the various constituencies. This is something I've never envisioned, never anticipated, certainly never hoped to have experienced. But unfortunately, it's not a dream. This is almost the nightmare. The level of poverty that some persons in a matter of weeks are experiencing, Many persons unable to pay their rent. Many persons cannot meet their mortgage. Many persons do not have the finances to find food to put on their table. It's a challenge. I salute organizations like the Red Cross, organizations like Great Commission Ministries. And as a matter of fact, in speaking to, communicating with Mr. Hansel, he said to me that in the past week, that there's been an increase in persons who have been evicted from their homes, particularly from their apartments, particularly mothers with children. And they just do not have anywhere else to place them. And so the need for hotel rooms and accommodations is a tremendous one. It's a great need for that. Mr. Speaker, what concerns me with regards to this resolution is that, and many persons have brought it to my attention and asked me my thoughts on it, with us here, the resolution to extend, but on the weekend, in the constituency I represent, Golden Isles constituency, group of persons campaigning in Mount Moriah constituency, group of persons campaigning, and several other constituencies, I think in Elizabeth constituency, group of persons campaigning. And my understanding and understanding of many in the general public is that that was discouraged. As a matter of fact, in the churches, we know what the limit was, and in gatherings and cemeteries, we know what the regulation is supposed to be. But it seems as if it's different when it comes to politics and to campaigning. And it seems the perception is that it's a conflict, that why should we need to extend this if everything seems to be back to normal or as close to normal as we can expect it to be? Then why the need to extend this? And I was listening for a reason or reasons to support it, to support it for the extension, but I did not hear anything that was sufficient for me to support the resolution to extend it. And that's my position. But Mr. Speaker, before I sit also, I'd just like to communicate to this House with regards to a very important decision for myself personally, on my personal and my political journey. I entered this historic place as a free Black man with my integrity intact. And Mr. Speaker, when the time comes that I make my final stand in this place, I intend to do so and to leave as I came, a free Black man with my integrity intact. Proverbs 20:7 states, "The righteous who walks in his integrity, blessed are his children after him." Brian Tracy states, "Integrity is the most valuable and respected quality of leadership. Always keep your word." An unknown quote about integrity says, "Choosing your thoughts and actions based on values rather than personal gain." After I read that, Mr. Speaker, I thought of my mind reflected on Tuesday, June 19th, 2018, at about 3:05 in the afternoon, when I received my letter of termination. And Mr. Speaker, for me personally, I am a cancer survivor. I had thyroid cancer, I had a thyroidectomy, and it took a financial toll on me. And quite frankly, when it was time to vote, I wasn't much of a wrestler, but I thought about it, and I knew that financially would not be a wise decision for me to vote against the bill, because I knew what would happen. But because of my convictions and because of I guess the way I'm made up, I could not do anything else but that. And so for me, I knew what I was about to venture into, but I knew what I had to do. And so as I reflect, as I read that quote on integrity, I reflected on that. And the record, Mr. Speaker, will reflect that on Wednesday, December 11th, last year, 2019, at about 4:25 in the afternoon in this place, that I gave the House notice that I would no longer be sitting as a member of the governing Free National Movement, but as an independent. This time has allowed me, Mr. Speaker, a period of great reflection. And I listened to the member of Centerville as he was making his contribution, and the words of a song by Bob Marley came to mind that says, "Every man has a right to decide his own destiny. And each of us has a right to do that and to choose the path." It has always been, Mr. Speaker, my desire, my dream, from time to time, from since I was a young man, growing up in Greencastle, Eleuthera, to serve our great country and to make life better for our people, particularly the poor, the indigent, the marginalized, the disenfranchised, the downtrodden. And Mr. Speaker, the people of the Great Golden Isles constituency have given me that opportunity, tremendous opportunity. It is the opportunity of a lifetime, and I am deeply grateful to them for their support, without which I would not be here today. It is not necessary, Mr. Speaker, for me to revisit all of the many. And there you have it, right? These are man-made, Mr. Speaker, so you know. But it is not necessary, Mr. Speaker, for me to revisit all of the necessary reasons that led me on this journey to where I am today. However, Mr. Speaker, what is important to say is that we have a responsibility as public servants to always do what is best for the people of our country as we perceive it to be, and based on the best available information to us at the time of our decision. Mr. Speaker, while we may not always be right, Mr. Speaker, we must always be true to ourselves and true to our God. And Mr. Speaker, for me, I have been in constant conversation with my wife. I've spoken, Mr. Speaker, to members of my family, constituents, to our church leaders, religious leaders, and others. I've also thought and prayed long and hard. And it has become extremely clear to me what I must do. It is time for me to do what I believe is best for me. Mr. Speaker, I've been in conversation with the leader of the opposition, and after careful reflection, I've decided, Mr. Speaker, to join the Progressive Liberal Party. I spoke to the leader of the opposition about joining the PLP and sitting with his parliamentary caucus from now until the general election, offering to be the next representative for the Great Golden Isles constituency as a Progressive Liberal Party member of the parliament. And he assured me, Mr. Speaker, that he would welcome me into the party and into his caucus. Mr. Speaker, in the words of Psalms 25:1, where the psalmist stated, say, may integrity and uprightness preserve me. As the member for Elizabeth quoted earlier, the late Reverend Dr. Martin Luther King Jr., who spoke of the ultimate measure of a man is not where he stands in moments of comfort and moments of convenience, but where he stands, Mr. Speaker, in times of challenge and controversy. And so, Mr. Speaker, as I take my seat, I say that may Almighty God, Yahweh Elohim, continue to bless the Commonwealth of the Bahamas and to make the wealth common. The luta continua, the struggle continues. Golden Isles cannot support the resolution. I rest.
Thank you, Honorable Member. As many, Chair recognizes the Honorable Member for the Exumas and Ragged Island.
Thank you very much indeed, Speaker. This is a jubilant day in this Parliament.
Wonderful.
And I wish I could sing like my brother from St. Andrews.
I'm the praise that song. Glad they won.
I would sing a glad day, a wonderful day. Thank you, Mr. Speaker. I am always grateful on behalf of the people of Exuma and Ragged Island. But today is in fact a jubilant one. I want to express this great happiness and triumph as I welcome the member for Golden Isles to the fold of the Progressive Liberal Party. I take this pleasure on behalf of our leader, the Honorable Philip Brave Davis. He will be issuing a formal statement on the matter, but I wish to express how delighted I am on behalf of my colleagues, on behalf of the parliamentary team, party officers of the Progressive Liberal Party, supporters everywhere, and the supporters in Golden Isles constituency. The good member for Golden Isles has always spoken with passion and courage. And I've always admired his contribution to this place. The member has always stood for the tenets of democracy and empowerment and upliftment. He had a great passion for natural resources and making the wealth in the Commonwealth more common. And I always thought, as I do now, that his philosophies have always been in line with the Progressive Liberal Party. And I take this great honor. To welcome Golden Isles to the fold. You will find in the PLP a welcoming spirit. You will find that democracy is alive. You will find a leader who is secure.
Keep it a little noise, my member, please.
And you will find an environment where free speech is welcomed. So this is a jubilant day
Yeah.
on the opposition side.
Big Exuma, big.
I almost want to do the benediction now. But Mr. Speaker,
I want to hear about the fight now. Oh, yeah.
I would wish to make a few remarks in relation to the resolution. So Winston Churchill said triumphantly to never let a good crisis go to waste. And if there's nothing else left for me to say, I hope that the members opposite will remember this. And I hope that we will do a better job at balancing our trek for an improved economy and the management of this health crisis. We are a nation in crisis. There's a credibility crisis. There is a trust deficit as it relates to this administration. The Bahamian people have had enough of these emergency orders. They've had enough of this animal called the competent authority, and I say that respectfully. We have found it appears no way to move forward from what appears to be a constant state of emergency. We are allowing a good crisis to go to waste, it appears, because it appears 6 months in, we have not examined the legislative options we have to put in place regulations, whether it's through the Health Services Act or the Quarantine Act, to allow us to live in the new normal with COVID. The competent authority says COVID will be with us. And I have said constantly, we cannot continue to live in a state of emergency where civil liberties have been surrendered to the hands of the competent authority, where parliamentary oversight has apparently been surrendered to the competent authority. And we come to this place and we ask for 60 days, then we come back and we ask for 30 days, knowing full well that there would be no checks and balances of the system as it is intended. So we will not support this resolution. Let me be very clear. Mr. Speaker, the opposition in the early days of this crisis formed a COVID task force. And I want to say a special thank you to the chairman of this task force, who have always provided a very simple formula as to how we might make inroads on how we live with the virus. Number one, adequate testing. Number two, contact tracing. Number three, adequate quarantining. Number four, adequate hospital capacity. So I want to get back to the fundamentals, the basics. On testing, it appears that it's still not widely available enough. In a family island, there were 3 people living in a house. 2 exhibited symptoms. 1 was airlifted. The 3rd person, who did not exhibit symptoms, presented to a clinic and asked for a test and was denied. We hear real stories like this, and I tell you, it's quite troubling. When it comes to contact tracing, we've heard multiple persons who have been tested positive say, nobody asked who I was in contact with. Nobody called. When it comes to quarantining, it's regrettable that we sent positive cases home to a 2-bedroom apartment where 10 people live. We're not going to beat the virus this way. When I spoke to this House in March, I believe, on the first occasion, I referenced the Javits Center in New York that was converted into a hospital. And I spoke to the need to be proactive and expand hospital capacity. Regrettably, we have not beefed them up enough. I won't venture to tell many stories, but there has been some effort. But the effort has not been robust enough. The ecosystem is challenged, Mr. Speaker. And until we make the necessary corrections as the PLP's COVID task force has preached from day one, we will be challenged in the new normal. Whilst we welcome the opening of the economy, in many respects, we are still concerned. And I want to go on record as encouraging the Bahamian people to continue to follow the protocols. Because COVID is still real, Mr. Speaker. And I also want to take this opportunity to commend the health officials, Dr. Dal Regis, the entire team. This has not been an easy process, no doubt. Former minister. They've all put their shoulders to the wheel. The current minister. I wish him well. The healthcare teams across this country. In Exuma, we have a challenged team in Exuma. And I thank them for the work that they've done during very difficult times. The clinic administrator, Barbara Bethel, the doctors, Dr. and Mrs. Dr. Jewel, and Dr. Pinder, Nurse Fernanda, the entire team who continue to go over and above the call of duty to continue to keep the system running. Mr. Speaker, 6 months in, we are continuously challenged of the services being provided to the Bahamian people being inefficient in many respects. Bahamians still complain of not being able to access food assistance. The rental assistance program was dead on arrival. The hospitals are overcrowded. The Minister of Finance says programs are running out of money. A Grand Bahama building supplies company today says their account is on hold because they have some unresolved issues with the government. A grocery store in Abaco has posted that they're no longer accepting the coupons from social services until further notice. We're a country in crisis. And it didn't have to be this bad. But we were not proactive enough. We were reactive in many respects. We're 6 months in and we still don't have an economic mitigation plan. But it's coming soon, I hear. NIB is telling some persons who make contact for assistance that they got assistance in November under the government assistance program, so they can't claim again. I hope this isn't true. They were hungry in November, and they're hungry today. So I trust that we will address the pains and the frustrations of the Bahamian people. Mr. Speaker, we want to be proactive with respect to the management of our economy. On April 10th, we released a blueprint to minimize or mitigate the economic fallout from COVID. We said bulk up on cash. You might need it. If you don't need it, send it back. We said, and many of you laughed, like some of you are laughing now. But yesterday you were saying your programs are running out of money. So you've got to decide how to be more proactive. And we want to help, you know. That's why we share our ideas and our plans with you. We said be bold. We said invest heavily in digitization. Winston Churchill said, never let a good crisis go to waste. We want to help further, but we need some requested reports. We've asked for more transparency. We've asked for more accountability. We've asked to see loan agreements from the IDB, the CDB, and the IMF. We still don't have them yet. We want to be helpful. 6 months ago, on April 10th, we said, put together a debt management committee. And what do we know? Yesterday, I was so proud to see the member for East Grand Bahama on the steps of Cabinet talking about how a new debt management committee will be implemented. Well, we're 6 months in. Didn't have to be this bad. If we were more proactive and less reactive. The issues are many. Small businesses are struggling. They employ 70% of Bahamian people. We ask you to dialogue with them if you haven't. I'll speak more in detail on the issues at another time. I promised South Beach that I will endeavor to be brief. The member from South Andrews talked about school contracts. They're apparently being determined in Nassau. The process is Nassau-centric, without regard for local intelligence. We're concerned about this. We are concerned to know the details on contracts issued by this government since March. My recollection serves me correct. This is separate and apart from the school contracts. If my recollection serves me correct, these emergency orders suspended the normal protocols of issuing contracts. Therefore, I will put you on notice today that the Public Accounts Committee will call for copies of all contracts issued since the first lockdown, because the Bahamian people expect us to bring the type of parliamentary oversight to the management of our country that they expect. And we will not rest until we get the reports, the details, the agreements, the contracts that we need to see. This administration came to office on a soapbox of transparency and accountability and equity and a lot of words that we subscribe to. Time for the rubber to meet the road. The Bahamian people want you to live to this promise as well. There are many others you haven't lived up to. We'll come to that in time. But on the question of transparency, accountability, and equity and fiscal management, you must give an account. And that time has come. Mr. Speaker, I call on the competent authority to swiftly issue the order as it relates to his presentation today. There have been occasions where there have been lengthy delays. I have already received myriad of questions. In many respects, the presentation lacked clarity. I've received questions as it relates to inter-island travel. I've received questions as it relates to funerals. The public heard about weddings, but they have not heard about funerals. And we want to understand what applies as it relates to funerals. Here you don't have a cultural obligation, familial obligation to put our family members to rest. Decency, and with as many supporters there in these difficult times. And we want to abide by the protocols. So we want to understand what they are. We know that it's okay to campaign because we saw teams 30 deep on the streets over the weekend. And I'm happy that my colleague from Golden Isles has raised this issue. There cannot be one set of rules for you and a different set of rules for everybody else. This has been happening much too often across our country. Big teams 30 deep in some places, some wearing no mask. Some people say the team members were hired or paid or... I'm not getting in your business. All I'm saying is there cannot be one set of rules for you and one set of rules for everybody else. And we're concerned about that. Mr. Speaker, over the course of this season, I expect that the airs of COVID and Dorian will be ringing. And they were a serious crisis for our country. But I am of the view that this administration has botched the Dorian recovery. I am of the view that you have a reactive economic recovery policy. I am of the view that many of these emergency rules and orders have been flip-flopping and zigzagging and has made the business community dizzy and cannot really predict how to manage. I am of the view that many of your decisions has eroded public confidence in the government. Many of the stakeholders in the tourism industry has gone on record as saying there's not enough predictability and not enough testing, and therefore that will slow their recovery. I'm of the view that the Bahamian people will never ever forget. Now I'll launch a movement with my colleague from Golden Isles, #NeverForget. Because I don't want the Bahamian people to ever forget the failures and the incompetence and the missteps of your administration. Mr. Speaker, I am grateful for the love and support of the people of Ragged Island and Exuma. I promise them that I will serve them with diligence. I promised the people of Ragged Island that I would never forget them. When others do, I won't. And I talk about it often because I want them to understand that I have not forgotten that they still need a clinic. In the past 6 weeks, laugh if you will, but in the past 6 weeks, there have been 2 construction-related injuries. There's been 1 very serious diving incident that required airlifting to New Providence. It took 6 or 7 hours for the patient to leave Ragged Island after the incident was reported. There was a serious boating accident involving our officers of the RBDF, reported publicly. And there was a serious police-involved shooting in a chase that reportedly began off the coast of Ragged Island. It ended in Exuma, luckily. And those persons presumably would have gotten care much sooner than they would have gotten had the incident occurred in Ragged Island. It's a military base in Ragged Island, just outside, perhaps on days when they can't get in. We must support our Marines. We must support the people of Ragged Island. I know you'd like to hear me not talk about the clinic that's needed in Ragged Island. But I hope you understand, as a result of these very serious 6 incidences I cited, 1 more was airlifted as a result of a serious illness, not an accident, serious illness, life-threatening. We can do better in this country. And we must not forget the least amongst us. Mr. Speaker, I was delighted to be able to confirm today that Exuma was a part of the intended list as presented by the competent authority. But I want to offer a special message to the wonderful people of Exuma. COVID is still real. We have more freedoms. With freedoms come responsibility. You can still catch it, even though the curfew may have gone away. So I encourage you to wear your mask, social distance, wash your hands, sanitize surfaces, and as much as possible, avoid large gatherings. And even though gatherings can now be larger, COVID is still real. I want to send my thanks and love and appreciation to the people of Exuma and Ragged Island giving me the opportunity to speak on their behalf. I promise them to continue to serve them with diligence and to continue to speak fearlessly on their behalf. I end with the jubilations that I began with, Mr. Speaker. Had this been decades ago, I may have said my soul was dancing. If I could sing like the member for South Andres, I may have tried. But I simply want to end by inviting and welcoming the brother, Vaughn Miller, member for Golden Isles, to the fold. Progressive Liberal Party is a great organization. We have a big tent. We have a legacy of achievement. We have created many of the important, significant institutions in our country. The PLP is an institution that builds institutions. And I am grateful that you can also proudly now proclaim all the way. Mr. Speaker, thank you very much.
Thank you, Honorable Member. As many? Chair recognizes the Honorable Member for Tall Pines.
Thank you, Mr. Speaker. And unlike my colleagues who said that they would not take up all of their time, I would do my best, Mr. Speaker. In fact, I'll guarantee you that it would not be 30 minutes, maybe 15 the most. Speaker, it's always a pleasure to stand in this honorable house.
Just a moment.
Sorry, Mr. Speaker.
The chair recognizes the Honorable Member for Bamboo Town.
Mr. Speaker, I thank the member for yielding. We are almost at the 7 o'clock hour. I'm seeing that the member said that he would be probably more than 10 minutes. I do now move that the business of this house to continue beyond 7 p.m. this afternoon.
Honorable members, it has been moved and seconded that the business of this house to extend beyond the 7 p.m. hour. As many as are in favor will remain seated. Those who oppose will stand. The business of this house will extend beyond the 7 p.m. hour. The chair recognizes the Honorable Member for Tall Pines.
Thank you, Mr. Speaker. Again, got to say that, as usual, it's always a pleasure to stand in this house. This historic house. You reminded us that we're about to celebrate 291 years as a democracy in this house, in this country, and in the world. And that's very significant, especially, Mr. Speaker, having heard the contributions of my colleagues prior. Speaker, it's indeed a pleasure to stand here and to represent the people of Tall Pines, and I always say, by extension, the people of the Bahamas. Because everything I say on behalf of the people of Tall Pines, I want you to know, my colleagues to know, that I'm speaking really for our country, young and old, rich and poor, black and white, of all religions and denominations, etc., but for our citizens. And so I thank them for this opportunity, and I thank my team members, Mr. Speaker. If I may start by saying I thank my team members for being so diligent and so hardworking, even during this period of COVID-19. I thank them for their dedication to our cause in Tall Pines and their dedication to their country and their community, our constituency. Speaker, I also wish to extend well wishes to our members of our staff. It was mentioned that several of them are suffering from COVID. I want to extend you and I as a team and the clerk here, our best wishes to them and their families. Speaker, this October 2020 extension is an important one for us to be here debating today because, as several members have said, we've been at this resolution on several occasions. We've been at this resolution on several occasions. And now it's appearing to be, for some of us, and even for some of our citizenry, just passing the buck month after month, passing a resolution. And to use the words of a colleague here in Parliament, extending or empowering the competent authority even more and more and more. Mr. Speaker, on the onset, I want to say, before persons read into that line, that Tall Pines will support and do support the extension. However, Mr. Speaker, I think it's important, though, that we remind the Bahamian people, from Tall Pines, from Southern Shores, from Andros, both constituencies, Eleuthera, both constituencies, Grand Bahama, that
we do still live in serious times. And yes, our civil liberties are being somewhat, I wouldn't say taken from us, but our civil liberties are not curtailed. It is not as open to live in the Bahamas as it used to be. In terms of moving around, in terms of doing business, in terms of going to church, et cetera, et cetera. But I want to remind the Bahamian people that we are still in this together. In order for us to come out of this victorious, to come out of this stronger, there are certain measures that have to be taken. Nobody likes, and I know, Mr. Speaker, I've spoken on parliamentary procedures and parliamentary advancements and reform almost every occasion that I stand in this house. I'm not one to support anything about strengthening the executive powers in this house, anything about strengthening the prime minister's powers, because I've said it and I've said it before. I think the prime minister in the Bahamas and the Commonwealth, they're more powerful than presidents in republics. That's a different debate. So I'm not here, Mr. Speaker, to strengthen any prime minister, to strengthen any executive body. But I'm here, Mr. Speaker, to say that I think what we are doing in the office of, or the position of the competent authority and his responsibilities is something that has to be done, given the circumstances we live in. I don't, as a member of parliament, intend to be here in the next 5 to 6 months, Mr. Speaker, hopefully not, asking for another extension. But, Mr. Speaker, as the prime minister and the competent authorities have already spoke of, it's been less than about a year of us fighting this pandemic. We are now in the second wave, and we're fighting, Mr. Speaker, to prevent a third wave. And I would put it to this honorable House, and I'll put it to the members of our communities and our constituencies, that should we not keep our hands to the wheel, if we not continue to support the competent authority in his responsibilities and the committees and the bodies that work with him in giving him advice, we may find ourselves, Mr. Speaker, going through a very, very sad third wave. And so, yes, the competent authority has powers that many of us may not be comfortable with. But I think, Mr. Speaker, it's a situation that we find ourselves in that could only work. And I would submit, Mr. Speaker, thus far has been working for the betterment of the country. Personally, Mr. Speaker, in my analysis, and I consider myself a student of politics, and watching the competent authority, I don't think that the competent authority has demonstrated to the Bahamian people that he's abusing his powers. He's making decisions, Mr. Speaker, that aren't popular, but we in this parliament, we're not in the business of making decisions for our people that are always popular. We're in the business, Mr. Speaker, of making decisions for our people that's in the best interest of their lives and our country. We're not in the business, Mr. Speaker, of merely doing things and saying things that would have our constituents clapping and praising us. Mr. Speaker, we're in the business of doing things that will keep them safe, that will keep their families safe and their communities safe. And thus far, Mr. Speaker, I think the competent authority and the leadership around him and the committees and bodies around him is doing just that, Mr. Speaker. I need not, Mr. Speaker, given the time, talk about what this government has done in terms of helping our communities through this COVID-19 period. But I want to say, Mr. Speaker, that we will do more. And I'm encouraged by the competent authority, I'm encouraged by this government, that we will continue to do what's best in the interest of the Bahamian people. The Speaker, the Prime Minister and the member for Kalani spoke about the new changes or the new policies as regards our family islands, as regards curfews, as regards wedding and churches and funerals. And Mr. Speaker, on the issue of funerals, I had a discussion yesterday with someone, and I told them, they were talking about the fact that Bahamians, people can't bury their loved ones, et cetera, et cetera. And I do feel that, believe you me. I have persons in my family who have experienced the COVID-19, tested positive. And I understand the pain they go through. Luckily, Mr. Speaker, I've not had anyone in my family that's passed away because of COVID. But I'm more interested in making sure that we have less bodies to bury than bodies sitting up in a church, Mr. Speaker. I'm more interested in making sure that we have less bodies in our hospitals than bodies that want to go to a wake or to a repast at a funeral that we complain about. And I think that's the position of the competent authority, and I think that's the position of this government. That goes to what I said about popular decisions, or decisions that are not popular, but that are that which are needed. And so, Mr. Speaker, I endorse the Prime Minister's position. He spoke about tourism and the fact that we're looking to really open our brand again in October. Talk about what we need to do in terms of our health and safety measures. But, Mr. Speaker, I want to pivot for a second to say that I believe that as we move forward in addressing this COVID issue, as a member for North Anderson-Berry would say, as we move, that we have to be cognizant of the fact. And I think it was used here that we have to take these opportunities to learn. We have to take these opportunities to suck in what could be beneficial from the experiences that we've had. And I want to say, Mr. Speaker, because as the member for Elizabeth has indicated, that more young persons now especially are being found to be with this virus. And that our young people in any event have been, for the most part, those breaching, from what I've seen, some of the policies and regulations. That we have to make bolder steps to make sure that we are more prepared for these types of emergencies. Speaker, we talk about climate change and we see what's going on in terms of climate change. We talk about new health issues throughout the world. What are we doing as a nation to prepare ourselves? The Speaker, just in September, that's the beginning of this month, there was a Parliamentary conference whereby we looked at national adaptation of gender response and disaster and crisis planning, and that was hosted right here at this Parliament throughout the Commonwealth Caribbean, Parliamentary. And we looked at what we've done. And we looked at, we shared ideas from our different jurisdictions. We also, Mr. Speaker, there was a conference in May, whereby there was a conference where we talked about parliaments and how they're reacting to COVID-19 and how they're functioning. And so, Mr. Speaker, I want to say, as I always do, that this is a good opportunity for us to revisit how we do business in this house so that we can better respond to pandemics or health issues or economic issues or disasters, natural disasters. And so, yes, Mr. Speaker, as Elizabeth mentioned, as others have mentioned, we have to find a way to really modernize, reform the way we do business in this house. There's no reason, Mr. Speaker, as when we had the Parliamentary conference, the virtual conference, where other jurisdictions in our Commonwealth, in the Caribbean Commonwealth, had virtual parliaments. We are the fourth oldest parliament in the Commonwealth. Why is it? We claim to be, and we are, on GDP, the richest nation in the Commonwealth. Sorry, the third GDP in the region. Why is it that we cannot come to grips that we have to reform our parliamentary system and procedures? Mr. Speaker, we have to find a way, because I would put it to you, Mr. Speaker, just as we weren't prepared, that we weren't expecting Hurricane Dorian last year. Imagine if that had hit Nassau. How would we have addressed Parliament if it had hit Nassau? How would we have addressed it? Mr. Speaker, I am saying, Mr. Speaker, we have to find ways to also enhance how we address our own business in here. I've said it before, Mr. Speaker. For example, in Canada, Mr. Speaker, in April 11, 2020, Canada has, and we talk about these select committees. The member for Senate spoke about it, how we fail to have our committees and reports. For example, in Canada, there's a special Senate committee on lessons learned from COVID-19 pandemic and future preparedness. Why is it, Mr. Speaker? Now call on us to really look at implementing or bringing to establish a select committee a joint select committee when we are in a position to do so, Mr. Speaker, on what lessons we can learn from this pandemic, what lessons we can not only learn from this pandemic, from natural disasters. And we as representatives of the people examine our departments and our ministries, examine what we have done right, Mr. Speaker, and yes, I don't know why sometimes we're afraid of it, what we have done wrong, and put in place mechanisms and measures via our committees to meet those challenges for the future. Because we will be, I would guarantee you, Mr. Speaker, we will be challenged in the very near, hopefully not the very near future, but in the future. Why is it, Mr. Speaker, that in the United Kingdom, there are several select committees inquiring issues relating to COVID-19 as it relates to education and children's services, reform in public transportation, employment, where, for example, the select committee is looking at on what new measures in terms of their laws could be amended to reflect the new realities. What amendments could be made, select committees on education, what virtual classroom is going to be the thing of the future. After pandemic, Mr. Speaker, I see that we would still be in some hybrid form of education, in some form or fashion. Why is it that we as nation leaders in this parliament, we're not looking at what the Ministry of Education, what the Ministry of Youth and Sports are doing? Not in a necessarily a critical way, Mr. Speaker, but in a very positive way. And I always say that there's nothing wrong with questioning our executives, questioning the Director of Youth and Sports, questioning the Parliament Permanent Secretary of Education and their staff, and ways and finding ways in which what we could do and make things better via select committees, Mr. Speaker. And select committees, Mr. Speaker, I would put it to you, Mr. Speaker, as I find that it's a different debate with backbenchers. I find it very strange. I mean, if select committees don't function, I think, as well, and that's the reason why executives don't sit on select committees. They come in and they give their evidence, etc. But they don't chair select committees. Government members should not be chairing select committees. But that's a different debate, Mr. Speaker. But the point I'm trying to make is, Mr. Speaker, as the member for Exuma, the member for Elizabeth said, these issues create opportunities for us to revisit the way we think about our parliament. And so, yes, we can look at, there's a question of whether or not the competent authority should continue to be extended. We could even discuss ways in which that we could look at our laws to ensure that we don't have to be having the same debate in the next 15, 20 years. We don't have to be having this debate because we've looked at the issue, we've been there, we've done that, and we're moving forward. And so, Mr. Speaker, I want to take this opportunity also to thank the government of the Bahamas for all that they're doing for our people. I want to thank our teachers, our police officers and armed forces, our medical professionals, and all throughout our communities, Mr. Speaker, who are doing a marvelous job in making sure that our children are safe, our elderly are being taken care of, all of us in our communities who are in need are being taken care of. And I want to encourage this competent authority to be strong, to use these powers, unique powers, temporary powers, continue to use them for the betterment of Tall Pines, for the betterment of every constituency of the Bahamas, and continue to serve your country as best as you can. For the reasons, Mr. Speaker, that the competent authority has not exploited these special powers, for the reasons that the competent authority has caused us, Mr. Speaker, to see our way forward in addressing the COVID-19 pandemic in a very effective way. Because I believe, Mr. Speaker, and Tall Pines believes that there is truly an emergency in this country. There's an emergency still existing, Mr. Speaker, whereby the competent authority and its powers, at least, Mr. Speaker, for the time being, should exist. Tall Pines supports the extension of this, the powers of the competent authority and this resolution. Thank you, Mr. Speaker.
Thank you, honorable member. As many, the chair recognizes the honorable member for Bamboo Town.
You tell me eyes look shiny sometimes. Mr. Mr. Speaker. I don't need. Thank you. Mr. Speaker, I rise to briefly close this debate. And you know, Mr. Speaker, as I sat in this place and listened to the contribution of some members, I had to ask myself, in my opinion, whether some members of this House is living in an alternate reality, the Matrix, or whether they are living in the reality of the real, based on some of the things that has been said. Mr. Speaker, when last I checked, this planet, this globe, is still facing a very serious pandemic, an economic and health crisis. And Mr. Speaker, it didn't just start with this second wave today. Mr. Speaker, this started back for us in this country, in this national context, in March. So what did we do, Mr. Speaker, in March when we were faced with this national crisis? We came in here, Mr. Speaker, in full regalia, obeying the democratic process, and invoking the democratic process, Mr. Speaker, to use the piece of legislation that those who have come before us would have brought to this House to deal with these kinds of issues. And we voted for the Emergency Powers Act to be invoked. The democratic process that some members have been talking about that we need to continue with. We've done that, Mr. Speaker, almost every month. We come in here and we do exactly what we're doing. Debate the resolution and vote on it. Is that not democracy? So where's democracy not being observed? Or we need to restore democracy. And Mr. Speaker, what are we voting for? We come in this place and we vote to give the competent authority the opportunity to make regulations, emergency powers regulations, Mr. Speaker, to keep us safe. And no member in this House has disagreed that the application of those regulations during the first wave worked. No member. What members have now come and said is, we shouldn't continue using the tool that we instituted that worked. That somehow we should try and find some other means to address the continuous spread of this virus within our community. My grandma told me one time, if it ain't broke, you don't fix it. And then again, Mr. Speaker, I have heard it said in this place, and I ain't gonna be long, Mr. Speaker. I've heard it said in this place that the application of these emergency regulations is inconsistent. And I think the example used was what we did in Grand Bahama. And I'm sort of paraphrasing in regards to Grand Bahama and Providence. But Mr. Speaker, what we did in Grand Bahama is exactly what we did in Bimini when the cases were increasing. And we all know after July 10th, we had an exponential growth of COVID cases in Grand Bahama. Mr. Speaker, the Prime Minister stood up on July 19th and spoke to the nation and said on 24th of July, Grand Bahama will go into a lockdown for 14 days. During that period, Mr. Speaker, we had a number of persons, and as the Prime Minister also said, there was an exodus of folks from Grand Bahama to elsewhere in the country. I remember, Mr. Speaker, as the new minister on the 25th of July in a press conference, the day after the national the island lockdown of Grand Bahama took place. It was in a press conference with the Prime Minister where the Prime Minister put New Providence in a lockdown over the weekend for 3 days. Coming out of that, Mr. Speaker, the cases begun to rise in New Providence. The Prime Minister then came to the nation on the 3rd of August and instituted an entire national lockdown of the country. And as a result, Mr. Speaker, of the lockdowns, Grand Bahama was in a lockdown for an entire month, two-week cycles. And as the healthcare professionals would say, that's 2 cycles of the virus. We were able to break the chains of transmissions in Grand Bahama and we went from 20 and 30 cases in Grand Bahama down to 2 and 3. But in order to achieve that, Mr. Speaker, we had to institute nearly a month of lockdown on the island. Here in New Providence, Mr. Speaker, we've had, I believe, about 2 weeks of a lockdown in New Providence. And Mr. Speaker, as I understand it, and I am advised, and I understand that the member of Elizabeth was also a part of the team that planned that in those instances, especially in the Family Islands, that we would seek to keep the COVID cases down in those islands, particularly in Grand Bahama, because the healthcare facilities in Grand Bahama were severely compromised by Hurricane Dorian. And so that is why we moved quickly, Mr. Speaker, to be able to address that issue in Grand Bahama.
Sorry. The chair recognizes the honorable member for Elizabeth on a point of order.
I allowed the honorable member to complete his train of thought. But, Mr. Speaker, I think that the honorable member clearly must have slipped when he suggested that honorable members in this place are possibly living in an alternate reality or language such as that. Clearly, I don't believe that he would make such an assertion to other honorable members in this House. And I would ask him to respectfully just withdraw it, because we don't have to go into a tit for tat. Because I am certain, I'm certain that we can go back and forth and throw these type of jabs at each other, and you know, we are all in this together. So please, you know, I would ask through you, Mr. Speaker, to ask the honorable member to withdraw that statement about alternate reality for any honorable member in this place.
That's why I started off by saying, Mr. Speaker, in my opinion, I started off, Mr. Speaker, by saying, in my opinion, having heard the contribution of members, that's what I said. It seems to me, based on what it is that they would have said, that they are not. That's what I said, Mr. Speaker. And Mr. Speaker, the House gives me, the rules gives me that. In my opinion, having heard the words spoken by members, to be able to make that claim, Mr. Speaker, based on what it is that was said. And Mr. Speaker, I came back, Mr. Speaker, and qualified that even more so by saying, given what we are experiencing nationally and what the globe is experiencing internationally, Mr. Speaker.
Let me take a look at the rule a moment. With respect to, I believe the members referring to Rule 3317, where a member should not make personal reflections on other members or make imputations of improper motive. I think this falls under the category of personal reflections on members. When it is being suggested broadly that someone may be in a different alternate reality, that can have a whole lot. That's a pregnant statement. That's a pregnant statement that could give rise to a whole lot of, and you know, because I think it would be in order for to be consistent with the concept of honorable and the honor that we give each other in this place to not refer to persons of having this other reality, because that could go as far as insanity. And so, in that respect, I think that should, once the opinion don't bridge or breach the rules. That's what I was saying to the member for Exuma and Ragged Island this morning. Yeah, but you cannot have an opinion that is in breach of the rules.
Mr. Speaker, I accept the ruling of the chair, Mr. Speaker, in that regard, and I will move on, Mr. Speaker. But as I said earlier, Mr. Speaker, the Bahamian people who would have been watching would have had an opportunity to have heard all that we would have said in this place. And so, Mr. Speaker, I shan't belabor this debate, but simply to say, Mr. Speaker, that the necessary continuation of this resolution, Mr. Speaker, I believe was made quite clear in this House by members from this side. And so with that, Mr. Speaker, I will take my seat and I do move that the question be now put to continue this work for and on behalf of the Bahamian people.
Thank you, honorable members. Honorable members, it has been moved and seconded that the following resolution be agreed. Whereas pursuant to Article 29, subsection 1 of the Constitution, the Governor General may make a proclamation of emergency declaring that a state of public emergency for the purposes of that article exists in the Bahamas. Now, therefore, be it resolved that this House, A, approves the continuance of the proclamation made on the 29th day of June 2020 until the 31st day of October 2020. B, affirms the continuance in effect of the Emergency Powers COVID-19 Pandemic Regulations 2020 made on the 29th day of June 2020 until the 31st day of October 2020. C, affirms the continuance in effect of the Emergency Powers COVID-19 Pandemic Number 6 Order 2020 made on the 10th day of September 2020 until the 31st day of October 2020. D, affirms the continuance in effect of the Emergency Powers COVID-19 Pandemic Special Provisions Order 2020 made on the 30th day of June 2020 until the 31st day of October 2020. And E, affirms the continuance in effect of the Emergency Powers COVID-19 Pandemic Extension of Section 17, subsection 1 of the Local Government Act, Chapter 37, Order 2020, made on the 21st day of August 2020 until the 31st day of October 2020. As many as are in favor will remain seated. Those who oppose will stand. The resolution is agreed with noted with 3 members objecting and 1 abstention. Further resolutions. The chair recognizes the honorable member for Bamboo Town.
Mr. Speaker, there are no further resolutions.
Member statements. The chair recognizes the honorable member for South Beach.
May it please the honorable speaker. Mr. Speaker, it is with deep regret in my capacity as the Minister of Education
Honorable member.
that I extend to the family of young Reese Williams, a 7-year-old student of Thelma Gibson, who was unfortunately killed in what has been described as a crossfire. Mr. Williams is survived by his mother, Sandy,
his father Valence Thompson, his grandmother Melanie Thompson, and he has 3 older siblings, one of which is a teacher at L.W. Young, Miss Valencia Major. I wish also this evening to extend to the family of a dear brother and friend, a former chairman of the Free National Movement South Beach constituency, former council member within the Free National Movement, Mr. Anthony, commonly and affectionately known as Tony Albury, who passed yesterday. As you would expect, Mr. Speaker, our community is deeply saddened by this untimely, totally unexpected man of great selfless service quotient in the South Beach and the Bahamian society. We extend our condolences and our prayerful sympathies to his sons and his family, his business community, for which he had been a sterling representative for over 45 years. Eternal rest unto each of their souls, and perpetual light shine upon them. May their souls and the souls of the faithful departed through the mercies of God rest in peace.
The chair recognizes the honorable member for Golden Gates.
Thank you, Mr. Speaker. Mr. Speaker, I also join the honorable member for South Beach in offering condolences to the family of Anthony Tony Albury, who we've known for a very, very long time. And as he says, given stellar service to the party over the many years. May his soul rest in peace, and may perpetual light shine upon him. Mr. Speaker, the honorable member for South Beach, the Minister for Education, has told us and told the country that starting October 5th, in the government schools, there will be virtual learning. And he indicated there are 3 categories for these 3 different devices: preschool to grade 3, grades 4 to 6, and high school from 7 to 12. And as we know, most parents are hard pressed to find the money to buy these devices. We understand that these are difficult times. So, Mr. Speaker, Golden Gates will have its back to school bash. And this is our flyer, our back to school bash. It will be this coming Saturday, Mr. Speaker. And it will not be the traditional back to school bash where we have a lot of activities in regard to COVID-19 and necessary protocols. What we will do, Mr. Speaker, is we will do a free raffle of tablets. We know this is the most important thing. We know that everybody needs it. So that's what we're doing. The back to school bash is this Saturday at Golden Gate Straits Park. And you see on the reverse side of the flyer, it says a free tablet raffle. And we ask all parents to come in to the constituency office at 62 St. Vincent Road to register and to be issued a raffle ticket, because we're not issuing any raffle tickets on the day because we do not want those challenges that come from that in regard to COVID-19. We encourage persons who drive there to remain in their cars, and persons who walk, we'll have properly distanced chairs for you to sit in. And Mr. Speaker, we are very, very happy about this because we will be raffling across the 3 categories, Mr. Speaker, 60 brand new tablets. Thank you very much, Mr. Speaker.
The chair recognizes the honorable member for Mango Key, South and Central Andrews.
Thank you very much, Mr. Speaker. Mr. Speaker, I'll be very brief. I'd like to join my parliamentary colleague, the honorable member for the Exumas and Ragged Island, in welcoming the member for Golden Isles into the fold of the Progressive Liberal Party. On behalf of our leader, the Honorable Philip Edward Davis, Brave Davis in his absence, and also Leadership Council and the NGC, we'd like to welcome the member, formerly broadcast colleague of mine. We worked for many years together at the Broadcasting Corporation of the Bahamas. We had hoped for this day to come, and it has finally arrived. We are glad that you are here, sir, to serve. And also, I would like to note that tomorrow, the member for Golden Isles will be joining us at the press conference tomorrow morning at 10 a.m. at the Sir Lyndon Pinling headquarters on Farrington Road tomorrow morning at 10 a.m. with our party leader, the Honorable Philip Brave Davis. Also, I must say quickly, Mr. Speaker, in life there is death, that this evening we are saddened at passing of Muriel Ash. We simply call Lucas and Merrill in Smithsville, South Angeles, my birthplace, where my navel string is buried. If we say it down, we say navel. And this evening we are saddened. She was 97 years old, Mr. Speaker. And she would have been there from good old days of the GUBA, the Grand United Bahamian Association. Never let the old flag fall. The days of Empire Day and everything else. And this evening, I joined the Reverend Arlene Smith of an Olive Baptist Church in Smithville, the Reverend Livingston Smith, community leader, Elder Preston Johnson, and Cheryl and Sandra and many others, and Sheila and all the families of Smithville and South Andros, my hometown, and praying for that family this afternoon. Also, we know the passing of Deacon Arnold Reming of Deep Creek, South Andros, who would have passed, and his daughters, children would have attended high school with me back in the day, especially Malvese and Essie and those in Deep Creek. These are all members who would have been a part of our party, started with counselors. And this evening we pray for them and the families during this hour of bereavement. I'll join the member for South Beach, the noted deacon, one who I look up to. May their souls rest in eternal peace. We look forward to that day when they, along with all of us who prove faithful, would rise in glory. Thank you, Mr. Speaker.
Thank you, Honorable Member. Chair recognizes the Honorable Member for Yamagrove.
Thank you very much, Mr. Speaker. Mr. Speaker, I just rise to extend condolences to Mrs. Chess and Deborah Wood on the passing of mother and mother-in-law, respectively, Miss Dolores Dallin. Miss Deborah Wood sits on the executive committee for the Yamacraw Constituency Association, and Mr. Chess Wood is an MCM in the Great Party of the Free National Movement. So, and one of the founding members, correct? And so on behalf of the Yamacraw Constituency Association, my family, and indeed the party, in the absence of the Prime Minister, and with leave of the Deputy Prime Minister, I would like to extend condolences to the Woods family, and our prayers are with them. Thank you.
Thank you. The chair recognizes the Honorable Member for East Grand Bahama.
Mr. Speaker, I would just like to share in the sad condolences of our members on just learning the passing of Mr. Leroy Thompson, who was a former public analyst in the Ministry of the Environment, a tremendous human being, a very talented organist who served the Anglican Church for many years. The Holy Trinity, I think, in Stapleton. He was also a personal friend, fraternity brother, a lodge brother, and a mentor to me and to many. He will certainly be missed. And on behalf of the Brothers of Alpha Phi Alpha Fraternity, the National Panhellenic Council, on behalf of the District and Lodge of the Bahamas Scottish Constitution, on behalf of my family, I'd like to express our condolences to his family and to his friends who would hold such fond memories of his life with us. His service to this country was incredible, unmatched, just a pure, simple gentleman, humble. I'd also like to give condolences, and I don't want to call the name because I haven't had a chance to talk to the family yet, on the passing of one of our employees at the Public Treasury, who also passed away. As a result, the Treasury will be closed tomorrow, and I think it will reopen on Friday. But we want to express our condolences to her family on this very sad loss. Mr. Speaker, I didn't speak on the resolution, but I can tell you that there are so many, and numbers are continuing to grow, unfortunately, people who have succumbed as a result of this virus. And while we take it for granted that we are going to be okay, there's no way to be sure. And as I say to people, particularly groups of people every day, yes, we want commerce. Yes, we want to have our liberties. But I think every one of us wants to have our life. We want to live. And if we don't care about ourselves, we want our children and our parents and our brothers and our sisters and our aunts and uncles to live. Simple device. Simple device. Mr. Speaker, on behalf of my family, I express condolences. On behalf of the Ministry of Finance, we express condolences on the loss of our colleague.
Thank you, Honorable Member. Chair recognizes the Honorable Member for Central and South Eleuthera.
Mr. Speaker, so I'm going to ask that I may have an extra minute or two, because this is the first time I've had the opportunity to stand in this hall and send out some shout outs to my constituents. First of all, Mr. Speaker, I want to thank the people of the Commonwealth of the Bahamas for the support you gave me during my moments of sickness. To my wife, my family, thank you. To the great constituents of Eleuthera, you all were the winds beneath my wings. You kept me going. Thank you for that. Mr. Speaker, I stand here today. I want to send out condolences to the family of the Oldham's family in the Roxon area. Jerry Oldham was the educator, came to live among Bahamians for many, many years. He and his wife went throughout the length and breadth of the Commonwealth of the Bahamas, and they served the Bahamian people with distinction. Jerry Oldham is well known as an educator in the Commonwealth of the Bahamas. I'd like to send my condolences to his family on behalf of the people of Eleuthera. Mr. Speaker, since the last time I was here, I've lost quite a bit of constituents. In the passing, I haven't been able to send out my condolences. And so while I might forget one or two, I'm asking and begging your forgiveness. So gentleman in talk with me, Mr. Boyd, he was known as Mr. Boyd Carey, a proprietor who helped to build that community, who was a successful businessman. And he and his family continue until today. That business is open. He came and he contributed, he's passed on, and he's left his legacy for his family to carry on. Mr. Speaker, there's another young lady in James System, Miss Johnson, who was successful at her gas station in Leona. She passed away due to cancer. To her family, to all of them, I offer my condolences. Mr. Speaker, I have to speak about one who was dear to me. This is home, this is very personal, in the name of Mr. Joseph S. Deal. Joseph Deal was one individual who played his role as a community leader and a community builder in the community of Palmetto Point, and not just Palmetto Point, but Eleuthera in general, who was one who worked with the Ministry of Works in Eleuthera for many, many years as superintendent. Joseph Deal was one individual who brought softball, helped to bring softball to light in the island of Eleuthera, a softball giant, one who, the first manager who brought the championship to Palmetto Point. I remember those days. Joseph Deal was that individual. Mr. Speaker, not only did he do that, but he was the pastor of the church. He died in the position as the Corps Sergeant Major in the South Asian Army up to his passing. What a giant of a man. One who was my mentor, one who helped to teach me, one who helped to shape me in the man that I am today. After the passing of my father, he stepped up to the plate, and I will remember him. Mr. Speaker, the Prime Minister and the Minister of Works has left the chambers. But I want to say to the Prime Minister and to the Minister of Works tonight, on behalf of the people of Eleuthera, a promise made was a promise kept. Tonight, Mr. Prime Minister, the people of South Eleuthera say thank you. The dock in which we were asking for the past 25, 30 years is all reality. And the construction company, as we speak tonight, is making the necessary adjustments and repairs to the dock in Roxon. Thank you very much on behalf of the people of Jerusalem. And I say, a promise made was a promise kept. Thank you, Mr. Speaker.
Thank you, honorable member. Honorable members, there being no further member statement, I just want to express my condolences. I'm certain that many of you were shocked by the reports on the 21st of this month, Sunday, the 21st, when a 7-year-old young man lost his life to a random and reckless drive-by shooting on East Alexandria Boulevard in Nassau Village, in the Nassau Village constituency. I want to express my condolences to his mother, Sandy Williams, and to her family, and to her father, his father. And I want to also give thanks to some of my colleagues who visited the home on my behalf only a few days ago while I was still under quarantine, self-imposed quarantine, by the way. And despite the fake news on social media, I was tested negative. But they went out, the honorable member for Baintown, honorable member for Foxhill, and the honorable member for North Andros and the Berry Islands, as well as my deputy speaker for Tall Pines. They went into Nassau Village to bring comfort to the family members, and I want to thank them for that. And I want to let the family in Nassau Village know that tomorrow I shall come personally and visit you and to see how we can assist. We are thankful to the funeral directors who gave complimentary funeral services to the family. I think we need to bang on the table a little bit for that too. We're indeed grateful for that. And so on behalf of my wife and all of the people of the Nassau Village constituency who are traumatized by that event, we ask God peace and grace, particularly for the family as they go through this difficult time of bereavement. Appointments of select committees. Instructions to select committees. Just before I recognize the honorable member for Golden Gates, the member for Golden Gates had indicated he is the chairman of the select committee dealing with natural resources. And because of the circumstances, I believe that he is seeking an extension. The chair recognizes the honorable member for Golden Gate.
Thank you, Mr. Speaker. Mr. Speaker, I rise on behalf of the resilient people of Golden Gates as chairman of the House Select Committee on Natural Resources, which was appointed on the 8th day of July 2020 to the 1st of October 2020 by this House of Assembly pursuant to Rule 21 of the Rules of Procedure of the Honorable House of Assembly dated 2005. Mr. Speaker, we, the committee, have been meeting since our appointment and making progress in the circumstances, particularly having regard to COVID-19 environment and its consequences, which have resulted in several postponements of scheduled meetings. Mr. Speaker, in the circumstances, the committee unanimously determined to seek an extension of the life of the committee beyond the initial date of the 1st of October 2020. It is the committee's considered view at this time that we will need at least until the 1st of April 2021 to fully and completely, as best we can, address the totality of the terms of reference of the committee as agreed and approved by the House. Mr. Speaker, under the rubric, and I quote, rules governing select committees, close quote, page 17 of the said rules, pursuant to Rule 22.9, thereunder it states inter alia that, and I quote, the chairman of the committee may at any time report progress and ask for leave to sit again, including for an extended time, close quote. Therefore, as chairman of the said committee, sir, I now respectfully ask for leave to extend the time of the Select Committee on Natural Resources to at least until and including the 1st of April 2021. Thank you, sir.
Thank you, Honorable Member. Honorable Member, having heard your requests and also taking into consideration the events which would have prohibited you from being able to report by the initial date given, your request for an extension of time until the 1st of April 2021 is hereby granted. Discharge of select committee.
Mr. Speaker, if I may, it's just a procedural issue.
Yes.
It's a procedural issue that may or may not have, nothing may have turned on it, having regard to the events of this evening. Nothing may have turned on it, but I just thought I'd mention because it relates to the select committee, sir. And that is, you'd recall when you appointed the committee, as you said, according to the rules, Rule 6, paragraph 6, it talked about the proportionality, political proportionality, and having regards to what has happened this evening, that makeup has changed. So you might recall, Mr. Speaker, previously to tonight, we had two independents and one member of the official opposition. So as of tonight now, we have two members of the official opposition and one independent member. And I just thought I would raise that as a procedural issue. And I don't know if anything turns on it for you, sir, but I thought I'd raise it. Thank you.
Okay, Honorable Member, in that regard, I would have to look at my records to see the exact makeup of the committee and how the change made by the Honorable Member for Golden Isles would have affected the makeup of the committee, because the committee should represent proportionately, as close as possible, the makeup of the House. So when the House next meets, I will give a determination, a ruling on whether the committee needs to be reconstituted to reflect that change or not. Moving along with the order of business, discharge of select committees, notices for future meetings. The chair record. Honorable Member for Golden Isles, you remain the only member of the official opposition. The chair recognizes the Honorable Member for Bamboo Town.
Mr. Speaker. Mr. Speaker, I rise to renew all matters in the name of the government. Mr. Speaker, I move that the business of this House adjourns until 10 a.m. Wednesday, the 30th of September, 2020.
Honorable members, it has been moved and seconded that the business of this House do adjourn to 10 a.m. Wednesday, the 30th of September, 2020. As many as are in favor will remain seated. Those who oppose will stand. Final adjournment.
Mr. Speaker, I do now move that the House adjourns until 10 a.m. Wednesday, the 30th of September, 2020.
Honorable members, it has been moved and seconded that the House adjourns to 10 a.m. Wednesday, the 30th of September, 2020. As many as are in favor will remain seated. Those who oppose will stand. The House stands adjourned to 10 a.m. Wednesday, the 30th of September, 2020.
All right.